I see that people are starting to come back from our first breakout room. So good morning, good afternoon, everyone. Before we get started with the NIHHIS National meeting, just a few housekeeping items that I want to go over. This meeting is being recorded. Video recordings of the meeting will be posted to the NIHHIS website and YouTube page after the meeting ends. Additionally, since this meeting is taking place in a Zoom meeting platform, we ask the participants keep their cameras off and mics muted for the duration of the meeting. You will be asked to ask questions to our speakers via the chat function during the designated Q&A times. We hope that the chat can be used to post about resources and to comment on content that the speakers and moderators are discussing. I also want to note that live transcription is available in this platform. And with that, hello everyone and welcome to NIHHIS National Day 2. My name is Morgan Zabo and I am the Climate Health Communications and Outreach Coordinator with the NOAA Climate Program Office and work with the NIHHIS team. I'm extremely honored to welcome you all to Day 2 of our meeting. Before we dive into today's session, I first want to recap Day 1 of NIHHIS National, where we started with the theme of defining the problem. We had agency leadership from the CDC and NOAA speaking to the heat health problem and why it is imperative that we are addressing this issue that kills more Americans than any other weather-related event. We had presentations from organizations setting the stage with a broad overview of different heat issues, with the climate perspective to the social, health, ecological, and economic perspectives, and addressing the disproportionate impacts of heat and the local challenges. We heard remarks from Senator Ed Markey on new heat legislation, and we also had fantastic discussion of local impacts of heat and the local challenges communities face from state and local partners. We ended Day 1 sessions with closing remarks from the Biden administration priorities to heat from the White House and Department of State leadership. Day 1 officially closed with a networking session hosted by the NIHHIS National Steering Committee, and we want to thank all that attended the session in the Wonder platform. It was great to have the space to foster more conversations that will hopefully lead to great connections and relationships within the heat and health community. This morning, we kicked off NIHHIS National with a coffee discussion hosted by the Heat and Health Indicators Working Group of the Climate Change and Health Group. And it's a great segue into the sessions of Day 2, where we are addressing the theme of building equitable community resilience. Communities are the centerpiece within all the sessions today, and we are addressing equity, and that will be woven not only through Day 2, but all 3 days of the NIHHIS National meeting. We hope that the sessions you hear today will provide you all with a greater sense of empowerment of how to address heat and health in your community. We have a fantastic lineup of speakers, panelists, and opening and closing keynotes for you all today. We're extremely honored to have leadership from EPA and FEMA kicking us off today. These two agencies are key partners of the National Heat Health Information System, and we are grateful to have your leadership present to address your role in NIHHIS and heat at large. And so to officially kick off the start of NIHHIS National Day 2, I want to introduce Victoria Ludwig with EPA's Heat Island Reduction Program to introduce our first keynote speaker, Janet Mccabe, the Deputy Administrator for the Environmental Protection Agency. Off to you, Victoria.
Thanks, Morgan. Hello, everyone. It is my privilege now to introduce the Deputy Administrator of US EPA, Janet Mccabe. She returns to EPA. I'm just going to tell a little bit about her and then hand it over. She returns to EPA after spending 7 years working as the acting assistant administrator of my home office at the agency, the Office of Air and Radiation under the Obama administration. Prior to rejoining EPA, she was a professor at the Indiana University McKinney School of Law and director of the university's Environmental Resilience Institute. Her work at the university centered on establishing innovative, research-informed, and actionable solutions to reduce environmental risks and help protect the health of communities and families. Over the course of her career, she has spent time working for state environmental agencies in Massachusetts and the Hoosier state, Indiana, which is her longtime adopted home state. And with those states, she focused on implementation of the Clean Air Act and other air quality issues. And prior to joining EPA for the first time in 2009, she was executive director of a children's environmental health advocacy organization based in Indianapolis called Improving Kids Environment, Inc. Janet knows firsthand through all of her experiences that programs to improve public health and protect our environment are strongest when they are informed by a diversity of perspectives and rooted in science, transparency, and the law. Deputy Administrator Mccabe, thank you so much for being here, and I'll turn it over to you.
All right, Victoria, thank you so much for that nice introduction. Occasionally it's nice to remember all those things that I did in my life, but I'll just start by saying once an airhead, always an airhead. I think that will always be with us. It's so great to join you all today, and I'm so thrilled for EPA to be part of this important national dialogue around real world solutions to protect Americans and everyone else from the impacts of extreme heat, impacts that could completely change life as we've gotten used to knowing it, and with significant impacts. It's also great to be giving remarks alongside Victoria, FEMA's Deputy Administrator for Resilience, and what a change we're seeing here in the federal government and elsewhere, that we have titles that have resilience right in the title and offices that are focused on that. I want to thank NOAA and the CDC for spearheading the effort to establish the National Integrated Heat Health Information System that I now know is pronounced NIHHIS. I hope I've gotten that right. To bring the federal family together for the first time to map out and deliver a whole of government approach to extreme heat resilience. And I think I've certainly learned over my experience at EPA during the Obama administration and ever since then, the fact that the challenges of climate change and the things that come with it, like extreme heat, really do take a whole of, insert your noun here, government, society, industry, whatever. It takes all of us coming at it from our different perspectives to actually understand it and develop solutions and implement solutions to these challenges. EPA has been a proud member of this group since it got started, and very much look forward to continuing our close engagement as we embark on our strategic planning process for the years to come. We're also very pleased to be involved in President Biden's interagency working group on extreme heat, for which EPA's Administrator Regan serves as co-chair, together with NOAA Administrator Richard Spinrad and Department of Health and Human Services Secretary Xavier Becerra. These are just such important opportunities. We're working with all the federal agencies represented on that working group to develop a holistic, coordinated approach to reduce heat-related illness, protect communities, and support our economy. And I think it is a reflection of how everybody across the government, at the highest levels of government, understand that dealing with extreme heat is an issue that warrants this kind of attention and this kind of focus. As a leader among many leaders on climate change science and research, greenhouse gas emissions data, public education, and regulatory and voluntary initiatives to reduce emissions, EPA deeply understands the impacts of extreme heat, one of the most urgent and widely felt realities of the worsening climate crisis. Americans and communities across our country see and experience heat hazards in their daily lives and communities. Often we say we are one EPA, or that we're taking an agency-wide approach to a problem. When it comes to our work on heat hazards, these expressions could not be more true. In addition to longstanding activities to address urban heat islands and raise awareness of heat health solutions, we continue to prioritize heat adaptation and mitigation across the agency. So let me just mention a couple of our activities. For over 20 years, EPA's Heat Island Reduction Program has helped build the capacity of communities to design and implement successful strategies to cool our cities through nature-based solutions and cool surfaces. Recent work has focused on understanding the important connection between heat islands and their inequitable impacts on underserved communities, a huge focus of this administration and of this EPA. As part of our continuing work to document observed evidence related to the cause and effects of climate change, we developed technical materials for the public on heat-related climate indicators, including heat waves, heat-related illnesses and deaths, and seasonal temperatures. In 2021, we produced a report on climate change and social vulnerability, which looked at how socially vulnerable populations may be exposed to the highest impacts of climate change. For example, we found that with just 2 degrees Celsius of global warming, Black and African American individuals in the US are 40% more likely than non-Black and non-African American individuals to currently live in areas with the highest projected increase in extreme temperature-related deaths. And if I could just take a minute here to emphasize how important it is for the federal government to produce information like this, and just refer to my recent experience in the university setting where I was working with researchers and also working with local governments in Indiana to try to implement and educate around some of these issues. Having this kind of research and resources and data from incredibly credible sources, the federal government, EPA in particular, was just essential for me to be successful in that job. So it's so important that we keep doing these things. Our EPA's Greening America's Community program has focused on green infrastructure design for water quality benefits and for heat mitigation. Our Office of Water also provides a variety of tools, policy guides, and technical assistance on green infrastructure as a stormwater management solution that brings multiple benefits, including reducing heat. These include city parks, green roofs, and tree planting. These projects they have so many benefits, right? And we can come at them from many different directions. And that means we can get different perspectives and different stakeholder groups and different implementers. I'm a stormwater person. I'm going to do stuff that's going to help reduce heat in our communities, and that's great. In addition, we're using funding from the American Rescue Plan to provide technical assistance for neighborhoods, to provide cleaner air and cooling centers in public school facilities in their communities. This will help ensure that we're prepared to protect our most vulnerable populations in light of long-term climate impacts. Air conditioning not only helps with heat, but when you install new HVAC systems, it also helps with indoor air quality, which helps with attention at school, lack of absenteeism at school, and test scores in school. So again, multiple advantages and benefits. The theme for today is building equitable community resilience to heat, which from our perspective of EPA needs to be solidly grounded in environmental justice. EPA has long worked to break through barriers and advance equity and justice. Since we know that extreme heat disproportionately impacts overburdened and underserved communities, we have a unique opportunity and I would say responsibility to make advances in both heat health and environmental justice. And environmental justice not only means that no group of people should bear a disproportionate share of environmental and health hazards, but also that all people have a meaningful and substantive opportunity to participate in decisions about the activities in their communities that affect their environment and their health of them and their families. At EPA, Administrator Regan has asked that all of us embed environmental justice, equity, and civil rights into the very DNA of the agency's programs, policies, and processes so that we can deliver real, tangible results to underserved communities. And indeed, in our strategic plan, which we just released for this year and the next 3 years, we have added advancing environmental justice and equity to our original 3 pillars that underlie everything we do at EPA. Follow the science, follow the law, be transparent, and now advance environmental justice and equity. So here are 2 recent examples of how we're helping to empower communities to develop solutions informed by meaningful stakeholder involvement. First, we just released an updated EJ Screen 2.0. I hope you're aware of EPA's EJ Screen. It's a mapping and screening tool for understanding demographic and environmental information at a hyper-local level. The demographic information in particular can help identify areas where those most vulnerable to extreme heat live. So if you're not familiar with EJ Screen, please check it out. Last December, we awarded $14 million in environmental justice grants to 133 different entities. Some of those grants have a direct extreme heat focus. Many of those grants will work to raise awareness of extreme heat and heat island issues at the community level through engagement in workshops, surveys, and school partnerships. Education is power, and people need to understand what is happening in their communities and then learn the things that they can do to help protect them and their families and also contribute to mitigating those issues. Engagement will definitely seek to develop community-driven solutions, such as alert networks and community gardens. What could be better than that? So as I close, I'd just like to say that EPA is so excited to work with all of you. We're so appreciative of everything that you do every day. The work that we do is only valuable to the extent that it is used by, amplified by, and helps to inform and empower the many, many activities that are going on around the country and need to go around the country. And I'm talking about people inside and outside the federal government, inside and outside state and local governments and community groups. I encourage you to reach out to us to learn more and get involved in EPA's extreme heat work and tell us ways that we can be more helpful to you or work together with you. Through NIHHIS, we can come together, local, state, federal, tribal governments, community organizations, businesses, researchers, and so many more to help make communities of all sizes across the country resilient in the face of current and future heat risks. Thank you so much for the opportunity to speak to you for a few minutes today. And I'm just really grateful for all the work you do. And Victoria, I will turn it back to you.
Thank you, Deputy Administrator. That was awesome. I think Morgan is going to MC from here. Thanks, Morgan.
Hi, thank you, Victoria. And thank you so much, Deputy Administrator Mccabe, for your remarks. We're so very grateful to have EPA leadership speak to the importance of addressing heat and health and to have EPA agency support in NIHHIS efforts. Next, I want to introduce Nick Schufro with FEMA to introduce our next keynote speaker, Victoria Salinas, the Associate Administrator for Resilience with FEMA. Off to you, Nick.
Good afternoon, and thank you very much. I am delighted to introduce Victoria Salinas, who currently serves as FEMA as the Acting Deputy Administrator for FEMA's Resilience Program. Resilience aims to help communities across the nation equitably adapt, survive, recover, and thrive in the face of natural disasters, climate change, and security threats through a variety of programs that aim to help communities better understand their risk, transfer risk through insurance, and build the capacity to prepare, protect, respond, and recover from disasters. Ms. Salinas has worked with communities across the United States and internationally to build resilience and recover after major disasters. Most recently, Ms. Salinas served as the Vice President for Programs and Communications at the nonprofit Fuse Corp, where she focused on strengthening the capacity of local government to addressing pressing community challenges. Ms. Salinas served as the Chief Resilience Officer and Deputy City Administrator for Oakland, California, where she spearheaded planning, policy, and legislative efforts to address climate, disaster, and socioeconomic vulnerability. Prior to that, at the World Bank and the United Nations, and in her previous experience at FEMA, she worked alongside officials at all levels of government to plan recovery efforts following major disasters. Ms. Salinas is passionate about driving social impact centered in partnerships and community resilience, and she has been steadfast in ensuring equitable outcomes for all. Over to you, Ms. Salinas.
Thank you so much, Nick, for the introduction, and so wonderful to be with you all today. A lot of what I'm going to share is going to build on what Janet's remarks. One of the things that I think strikes all of us most when it comes to extreme heat is that while for some it's a nuisance, for others it's a threat to their survival, and really drives home to the equity issues we face when we're talking about extreme heat. It is the deadliest type of weather event that we experience each year, killing more Americans than hurricanes, floods, and wildfires. And it doesn't usually show up on the death certificate. It isn't something that people are usually talking about when they're preparing for hazards or thinking about risk mitigation. And it's hard to track. It's hard to track for many reasons. And therefore it's hard for policymakers, or it's been hard for policymakers and the public to understand just the vast impacts of extreme heat and therefore how to take it seriously. But we're seeing it in the numbers, and a lot of the research that Janet referenced and other research is starting to show just how much that impact is, even in dollar terms. A cost of $100 billion a year on worker productivity alone in the US economy. And we're seeing lost jobs, or we're seeing people losing time off work. We're seeing the impact on the construction workforce, the ag workforce, so many different ways in which extreme heat is affecting our daily lives. One of the things that with extreme heat that I think in many ways differentiates it from other types of hazards is the role that government has had in shaping the landscapes that make extreme heat worse for certain communities. We've already been talking about how extreme heat more severely affects socially vulnerable communities. And that's a lot to do with land use planning decisions or the investments in certain communities. Millions, we see it in the workforce sector that I talked about already, but we also see it in the way cities have been planned with with urban heat island effects. And we can even see in like 2020 studies where historically redlined communities were nearly 5 degrees hotter than non-redline communities. These were all government programs decisions that today exacerbate the experience of extreme heat in specific places. And so there's been research that really shows that connection between things like urban heat island effect and where the investments have and have not occurred. The evidence is plentiful about the exposure to extreme heat and the disproportionate impact on children, seniors, economically disadvantaged. That we all know. And so it's really exciting to be in a moment in time in our country where it is such a core administration priority to be tackling this issue. It's also a big priority for FEMA. And it's not a hazard that even 5 years ago was one that was widely talked about in disaster risk management or within the agency. And it's one that in these last couple of years, the agency as a whole has been grappling with what is our role in extreme heat and how do we leverage our current assets, what we do, our mission to really address these impacts. And FEMA's mission is very simple. It's to help people before, during, and after disasters. And it's in that before space that we have really been focused both through our new strategic plan and our work as part of the Biden-Harris administration, because it's where we're able to invest in resilience. I want to share just a couple things that we're doing, which will enable us all to partner better together. First, several of the White House climate task force groups that Janet mentioned, FEMA's at the table with working alongside other agencies to really make sure that we are, as a nation, embarked upon implementing a bold strategy for extreme heat. We also are establishing a climate office to do a better job at working on these issues related to climate change as FEMA and take a more whole of FEMA and whole of government approach. We're also looking at all of our programs that we have to figure out how do we leverage our assets. So that's the second area. As an emergency management agency, we have a lot of different capabilities. Part of our job is to help partners understand risk. That includes the risk related to extreme heat. It's to help communities build capabilities, understand where their vulnerable communities are so that they can better support them. And so in many of these ways, FEMA is looking at systematically across all of its program areas to figure out how do we leverage our assets, what we do every day to support emergency managers, our other partners in addressing extreme heat. We're also helping communities take action. We have a huge portfolio of resilience investment tools, from the Building Resilient Infrastructure in Communities program to our flood mitigation assistance program, to new programs that have been authorized through the bipartisan infrastructure law, like the STORM Act, which is going to be a revolving loan fund for all kinds of disaster risk management issues. There are a lot of tools and there are a lot of resources currently available that can help communities address extreme heat. And as we're rolling out these programs, equity is at the forefront of everything we're doing. With our Building Resilient Infrastructure in Communities program, BRIC, we're expanding the direct technical assistance that communities can apply for. And we're trying to make it as easy as possible. This last go round, it was a 2-page letter. Tell us what you need so we can figure out how to get you in the game for being able to invest in your community's resilience to all kinds of things, including this challenge. We're also pushing on our programs to make sure that things that make sense as a solution for extreme heat are eligible, whether it's when you're repairing a community after a disaster, things like cool pavement or more tree canopy, all kinds of nature-based and physical infrastructure solutions to really help address these issues holistically. Our individual and community preparedness program is the one that really is constantly putting out materials at the community level on how to become more ready for all the different types of threats we face. There's already checklists out there on how to prepare for extreme heat that are through ready.gov, our teams have been putting out. DHS had a cool communities challenge that focused on really, it was a competition to bring in new ideas for how to address extreme heat. Point being, there are many different ways that as an agency and as a department, we're trying to partner with communities, empower them, provide the resources, the knowledge, the technical expertise to tackle this major challenge head on. In conclusion, the main thing I wanted to leave you all with was that it's going to continue to take partnership to make inroads with the effects of extreme heat in vulnerable communities. It's going to take partnership, both understanding how to make sure that we're supporting communities in the right way, making the resources available in government easily accessible, partnering together in specific places to make sure that we're leveraging each other's expertise and resources and programs, and looking at this as a core challenge for resilience, because as I started out saying, extreme heat is the hazard that is most affecting people, most taking lives today. And as somebody most recently from the Bay Area, what I was saying at the top about extreme heat being a nuisance and for some and a death sentence for others, I now know people who leave the Bay Area during wildfire season who can do that. There are people who just flee that season because they can, where there are plenty of people who cannot. And we are together working on really finding those solutions for those who cannot, to make sure that our communities have the ability to be resilient for everyone. So thank you so much for having me today, and looking forward to all the work that everyone is embarked upon and seeing some results for communities.
Thank you so much, Ms. Salinas, for your remarks. We are so glad to have FEMA leadership with us today to address the importance of community resilience when it comes to heat. And thank you again so much to both of our distinguished speakers for joining us to speak with the heat-concerned audience about this topic. And with that, we are now transitioning into our first session, Heat Action Plans for the 21st Century, Preparing for Heat Waves in a Changing Climate. This session will feature presentations that will address the following questions. What can we do before, during, and after heat events? How do we protect communities during heat events? From a local city perspective, what can we do? And how do we manage risks? To kick off the session, I want to introduce the moderator for the session, Nick Schufro. Nick Schufro was appointed to the Senior Executive Service in September 2016 and serves as the Deputy Assistant Administrator, Risk Management Directorate in FEMA's Federal Insurance and Mitigation Administration. He is FEMA's lead to the Extreme Heat Interagency Working Group. The Risk Management Directorate's priorities include producing flood hazard and risk data, assessing and translating risk information into action for multiple perils, and communicating risk and providing incentives to drive mitigation action for multiple perils. The Risk Management Directorate's program portfolio includes Risk Map, Hazard Mitigation Planning, National Dam Safety Program, the National Earthquake Hazards Reduction, Windstorm Impact Reduction, and National Building Science Programs. Off to you, Nick.
Thank you, Morgan, and thank you to everybody for joining today. So we have a great panel and not much time. So I'd like to first show the slide with our panelists again. I will introduce them separately, but the order will be Mr. Haggerty, Professor Eby, and Ms. Meadows. And if you move to the next slide, please. The fundamental challenge that we have right now in front of us in terms of planning, and as we just heard Ms. Salinas speak to our activities before incidents, is that we have 3 different communities that we need to get to communicate better. The simple diagram in front of us shows that we need public health officials, climate scientists, and emergency managers to understand each other's roles and understand each other's programs and figure out how to work collectively to address heat planning. They all have different programs, different objectives, but we are all crystallizing around the issue of extreme heat. We have a number of distinct tools, but they can be used collaboratively and in complementary ways, and we need to identify and articulate these similarities and differences. Today, we focus on planning, and our panelists will share their insights on how communities can best prepare for an increasing frequency, duration, intensity, and impacts of either standalone extreme events or cascading impacts from other natural disasters. Please note that FEMA is stepping into this space, and although we don't necessarily have direct statutory authorities, we are doing a number of activities and have a number of programs that can support the work. For example, we have the National Risk Index that is now integrated with NIHHIS, and the National Risk Index looks at 18 layers, including extreme heat and social vulnerability, and it identifies which communities are at most risk from extreme heat. We also work very closely with over 22,000 communities nationwide in our mitigation planning, and we are looking forward to having extreme heat integrated into our national planning efforts at the local community levels, and that's consistent with some guidance that was just released about a week ago. So the first speaker is Brendan Haggerty. Mr. Haggerty is with the Healthy Homes and Communities Supervisor in Multnomah County Health Department. He moved to the area, to the Portland area in 2007. He's trained as an urban planner, and he brings expertise in policy and data analysis and spends time analyzing the ways that neighborhoods shape health. And over to you.
Thank you, Nick. Good morning, everyone. Brendan Haggerty, joining you from Multnomah County Health Department in Portland, Oregon. And here in Portland, we have been on a roller coaster of climate hazards in the past few years. In the year leading up to the event that I'll talk about today, we had already faced record-setting climate hazards, including historic wildfire smoke in September 2020, an ice storm in the following February that caused the largest power outage in Oregon history. But neither of those compares to the mass casualty event of the major heat wave that we experienced in June of 2021, last summer, which we refer to as the Pacific Northwest Heat Dome. Next slide, please. Just for a little bit of context, Multnomah County is on the northern border of Oregon. It's geographically small, but is home to 824,000 people. It encompasses the city of Portland and some nearby suburbs. Hot weather is pretty unusual for us. And in the past few years, we just have a few days when temperatures get over the 90-degree Fahrenheit mark. Next slide. I'll start by just giving you some background about how we have typically handled heat events in the past. Portland is a city with generally mild weather, and air conditioning is far from universal. In the metro area, an estimated 1 out of 5 homes have no AC at all. So for us, a typical heat wave occurs every year or two, and that would look like a couple of days where temperatures hit the triple digits or maybe the upper 90s. Historically, we've had a fairly modest response to these fairly modest heat events. Our cooling centers were basically just extended hours at senior centers or at county buildings. Often those would have single-digit attendance, even when we were providing food and pet care. For most people, as we just heard, heat could be just an inconvenience. Hot weather might mean a trip to the movies or a swim in the river. I could show you a time series of heat deaths in Multnomah County, but it would be a pretty boring one. In most years, we have 0 heat deaths. Before 2021, the highest count in the past 20 years was 2 deaths in a single year. The next slide. So you might think we've been lulled into a sense of complacency when it comes to heat, and in many ways, we certainly were before this event. But we did have some preparation, and that's what I want to share with you today, because I want to convey a cautionary tale. If you work or live in a jurisdiction like ours, you've taken heat seriously. You have some plans on the books, but that might not be enough to prevent the impacts that we experienced last summer. We've been working on this problem for a decade, arguably longer, through participating in the Climate Ready States and Cities initiative from CDC, climate and health grants from NIHHIS, participating in a learning collaborative with the Public Health Institute's Center for Climate Change and Health. For decades, we've recognized heat as one of the most likely climate-related hazards that we could face in the multiple documents, these climate action plans that you see here on this slide. These are plans that have won global awards. We also had high quality, high resolution data from a heat mapping campaign like we've heard about in this conference so far, indicating where we might have urban heat islands in the city of Portland. For years, we've been improving our response to heat events. We have a standard operating procedure that uses thresholds informed by health information and the National Weather Service's heat risk tool. When those thresholds are met, we convene to assess the severity of the event, and we select from a menu of evidence-based interventions. And the next slide. When we look at research literature, one of the most consistently supported interventions is early warning communications. So we've established a communications infrastructure that amplifies warnings about forecasted heat and directs people to resources, even some with fancy bells and whistles like an interactive map of cooling centers and splash pads. On the next slide, I'll just review the things that we had in place going into this event. That included a climate action plan, local data, a heat response plan, and early warning communications. Even with these in place, we experienced major impacts. And that is in part because we were planning mostly for average events, not worst case extremes. On the next slide, I'll just spend a few minutes giving you a chronology of how the event unfolded and some of the impacts. As a quick disclaimer, this graphic has a flaw in that it is not the typical 7-day week you see in a normal calendar. So to orient you a little bit, June 21st was a Monday. A critical piece that I want to convey is that the forecast was consistently revised upward leading up to the event. When we began outreach on June 21st, the Weather Service was forecasting only a 20 to 30% chance of temperatures over 105 degrees Fahrenheit. So we were mobilizing, expecting something closer to the garden variety heat wave that we experience once or twice a year, rather than the record heat that we got. When we fully activated on Wednesday, the 23rd of June, the Weather Service had just issued an excessive heat watch to begin that Friday. On the 23rd, we convened a coordination call with 144 organizations and jurisdictions, everyone from first responders to housing providers to transit agencies and utilities. The next day, Thursday the 24th, the forecast was revised significantly with a record high forecast for Sunday, 109 degrees Fahrenheit. Previously, the all-time record in Portland was 107 degrees, last experienced in 1981. With the revised forecast, we decided to open libraries as cooling centers, in addition to the convention center and community centers we had already identified. By Friday, it got hot. The upper 90s is hot for Portland. Cooling centers opened, and we learned that the high temperatures expected on Sunday would be repeated again on Monday. By Saturday, the 26th, we had broken the all-time record for heat, and we gained support from the Red Cross in staffing and supplying our cooling centers. Sunday, we broke the record again, hitting 112 degrees Fahrenheit. We opened additional library branches as cooling centers. It was about this time that in my role doing syndromic surveillance during this event, I began to see reports of people ending up in the emergency department after being found prone in their yard or on a sidewalk. And it really started to become clear just how severe this event would be. By Monday, the 28th, when we set what would become the new all-time record of 116 degrees Fahrenheit, or around 47 degrees Celsius, the life of the city was seriously altered. Permits for activities in parks were canceled. Even the pools were closed because the decks were too hot. Trains stopped running because the overhead cables and tracks could not be operated safely. Interestingly, we expected a smog problem that never actually materialized, and it's thought that that's because people were so hunkered down, they weren't driving. Nighttime lows remained high on Tuesday night, and we finally closed cooling centers on Wednesday, June 30th. The next slide gets into some of our interventions. Our response to the event was unprecedented. We had warning messages translated in 7 languages, distributed through as many channels as we could think of. It was the first time we've ever opened a 24-hour cooling shelter. We opened 3 of them, recognizing that nighttime lows in the 70s and 80s would not provide adequate recovery. These shelters were resourced with behavioral health specialists, food, pet accommodations, and COVID vaccination. Anyone who needed transportation to a shelter could get a free ride on transit or call 211 to arrange a ride. And as a reminder, this was occurring during an existing emergency, the COVID-19 pandemic. Our messaging for more than a year had been to avoid being indoors with others. So it was an uphill battle to convince people, first of all, that they were vulnerable to illness or death, and also that they should congregate indoors with others. But we ultimately sheltered 1,400 overnight guests and provided over 6,000 meals. The next slide. We used every intervention in our plans, and we improvised many on the fly. There was an incredible amount of direct outreach to our most vulnerable populations. Our case managers were working furiously to check on older adults and people with disabilities. We had 12,000 client text messages go out in multiple languages to pregnant clients. We had 100 street teams conducting outreach to people living outdoors, distributing cooling kits with water and cooling towels. Now, outreach to multifamily buildings with affordable housing was admittedly a bit of a scramble. We started with a strategy of contacting property managers and asking them to open cooling respite spaces, post information about cooling centers, and check on residents. In some cases, city staff were dropping off cases of water at apartment buildings. Next slide. We lost dozens of community members. We didn't finalize that death count until December. These are deaths that were attributed to heat, the 72 deaths that you see on this slide. But if we look at all-cause mortality, it suggests that there were closer to 90 excess deaths that week. I can tell you that the next week, when our vital record staff started to process those death certificates, there were tears, many tears, as people reacted very viscerally because they realized that the deaths could have happened to them or their loved ones. Nearly all the decedents were older adults. The mean age was 70. About 90% were identified as white and 2/3 were male. A little more than half lived in multifamily housing, and a further 20% lived in a mobile home, RV, or a car. 4 out of 5 decedents lived alone. But as important as these demographic factors are, it appears that lack of air conditioning was really a key driver of mortality. None of the people who died had central air conditioning, and only 8 had portable air conditioning units. Of those, only 1 was plugged in and working. On the next slide. We got a chance to make changes to our response later that summer when another heat wave occurred in August, much less severe than the heat dome in June. But at that point, our healthcare system was already strained by COVID-19. And so we were aggressive in our response in an effort to avoid further burdening our healthcare system. We established things like misting stations in parks. We sent out mass text message alerts, and we adjusted the location of our cooling centers. There have also been major policy changes that I want to highlight. In the 2022 session, the Oregon legislature made it harder for landlords and HOAs to limit people's use of portable air conditioning units. And it funded a state program to distribute heat pumps. Oregon OSHA has adopted new rules to protect workers from heat and wildfire smoke. And also, Portland's Clean Energy Fund used tax revenue from large retailers to fund up to 15,000 portable heat pumps for low-income households. I hope our experience in Portland can be instructive for other places, because what we've learned that was, even with plans in place, we need to prepare for a worst case scenario and practice that response to identify the barriers in scaling up our response. Thank you for the opportunity to talk with you today.
Thank you very much. In the interest of time, I wanted to introduce Chris Eby, who's a professor for the Center for Health and Global Environment at the University of Washington. She's been conducting research and implementation of the intersection of heat waves and health for 25 years, including across the US, Canada, Europe, Africa, Asia, and the Pacific, focusing on understanding sources of vulnerability, estimating current and future risks of climate change, designing adaptation policies and measures to reduce risks in multi-stress environments, and estimating the health co-benefits of mitigation policies. And as we've seen from the chat, she even has former students on the call today. So with that, over to you, Dr. Eby.
Thank you very much. And I want to first thank the organizers for inviting me and want to congratulate all of the speakers. This has been a phenomenal meeting. So really, really appreciate all the work that's gone into this. I don't have slides. I'm going to make a few points and I'll try and keep them short because I know we're running a little bit out of time. As you've heard clearly throughout this meeting, heat action plans save lives, that nobody needs to die in a heat wave, that the deaths you heard about in Portland were preventable. Seattle was even less well prepared. And King County, the city of Seattle, did a tremendous effort. But even with that, the emergency departments were overwhelmed. We're still counting, but we know that we had a large number of excess deaths. And I'd like to pick up some of the themes that Brandon talked about when developing the heat wave early warning and response system that is part of a heat action plan. And I would like to enlarge the Venn diagram that Nick showed a few moments ago, because the question is who's at the table as you develop your heat action plan, particularly in this case, the early warning and response part of that plan, of thinking about who are the trusted voices for the red line communities, who's responsible for the elderly care institutions. Are there groups that we have yet to take advantage of? And I propose that there are quite a large number of groups that could be incorporated into heatwave early warning and response systems to increase their effectiveness. Because of the groups that are at high risk, particularly adults over the age of 65, think about some of the faith-based organizations that could be brought into the planning to make sure that they're part of the outreach, because they are trusted voices for large numbers of people in our communities. We have opportunities to start partnering with, for example, pharmacists. Pharmacists know each and every prescription drug that all of us take with our name and our phone number. And are there ways within their code of ethics to find opportunities to do other kinds of outreach to ensure that people are aware of what it is that they need to do and have whatever resources they need to do it? Do they need to get to a cooling center? Do they need to have help in terms of accessing that cooling center? Do they need to understand how they can reduce their core body temperature just with using water and electric fan? So there's lots of ways that we can reach out and think about these different groups that need to be at the table. Which groups need to be at the table, of course, is dependent on the local context. And it's one of the challenges and one of the great opportunities we have with developing early warning and response systems is that each one will be slightly different because it depends on the capacities and on the barriers within a particular region. Seattle has even less air conditioning than Portland in terms of across our residences. And that does create very special challenges to try and ensure that we do keep people cool. And so as these plans are developed, work on broadening out who is at the table and making sure that there are efforts when designing the plan to clearly articulate the coordination. What are the roles and responsibilities for all of the different groups? And it goes beyond the kinds of organizations that several people have mentioned, and thinking about how you bring in the police and the fire department. How do you bring in the EMT? We've got lots of stories here in the heat dome in Seattle, EMT personnel burning their knees on sidewalks, for example. how do we bring in the key leaders of the emergency departments? How do we reach out to various highly vulnerable groups that are not necessarily reached traditionally by the various organizations we've discussed? And we need to keep in mind that heat is an all of society issue. Here in the state of Washington, it was not just the excess mortality. This heat wave occurred during the height of the cherry picking season. We're one of 3 states that has regulations to protect outdoor workers, and a lot of work was done to protect outdoor workers and to bring in as much cherries as they could. Our wheat crop also was affected. So when we think about developing our early warning and response systems, how can we most effectively reach out to other entities that are being affected? The heat dome occurred during low tide in the Salish Sea. The estimate is about 1 million mussels, clams, and oysters were cooked. That's food security and livelihoods for many coastal tribes. They were not incorporated into discussions about what needed to be done in the short term. I honestly don't know what information would have been useful for them, but somebody knows, and it's having everyone at the table so that you can develop your coordination. When you look around the world at all the heat wave early warning and response systems, they have at least 2 meetings a year. They have a meeting at the end of the summer season. What went well? What can we do better? And a meeting at the beginning of the next summer season to do all the practical things. It never fails. Somebody changed their phone number. Somebody changed jobs. It's now somebody else's job to take on a particular task. And to make sure all of that information is available, it's up to date, and everybody knows exactly what to do. You don't want to be developing these kinds of programs on the fly. It's just too complicated to do it on the fly, but it's not difficult to do it in advance and to spend the time doing the coordination so that you have the information you need. And there's bigger opportunities around coordination. This meeting is a very important step in that direction. And thinking of the various communities, we just heard about Portland. I'll think personally about the state of Washington, definitely going to have a heat action plan here in King County and in Seattle. But how do you start doing coordination when there's going to be heat action plans in Bellingham and in Spokane and in other parts of the state? That there's a role for state agencies to help coordinate on what works in one place so that we don't keep reinventing these. We can build off of lessons learned. And there is a higher level of coordination, which, as Nick mentioned, is at the federal level. And we heard both about FEMA and about NOAA, of where can cities and where can states turn to start identifying the best practices and lessons learned. I happen to know that Phoenix has done a lot of work on reaching out to the unhoused. So many of our big cities have growing problems with people who are not housed. And learning what's worked in Phoenix may not work in your particular area, but having access to that information would save time and would make the plans much more effective. The third comment I wanted to make on the heat wave early warning and response systems is to start taking advantage of the significant information that's been coming out over the last few years. And that is thinking about developing tiered warnings. So the warnings would be based not just on temperature, but a combination of temperature and vulnerability. We know adults over the age of 65 are at particularly high risk. There's growing research about pregnant women and the risk of being exposed during a heat wave resulting in low birth weight babies, for example. And combining what we're learning about vulnerability and start thinking about warnings that start earlier. So 3 days out from the peak of the heat wave, start warnings with, if you're in these groups, you're already at risk. And these are the kinds of actions you need to take now and what you'll need to do over the next few days to stay prepared. So really bringing in the research to operations that is so common across NOAA into planning for heat wave early warning and response systems, and developing more nuanced systems so that we can protect more people. The last set of comments I'd like to make is around the heat action plans themselves. So heat action plans are the longer term planning for a very different future. Seattle, like all large cities, is a sea of cranes. We're constantly rebuilding. And thinking about how to work with city planners, Ladd talked a bit about that in the session yesterday, to have that longer term vision so that within your heat action plan, you have longer term planning, but you also have the heat wave early warning and response systems. And these are developed in coordination so that you have one inform the other, and make sure that as we go into an even hotter future with even more extremes, we are going to be prepared, we are going to be resilient, and we can help prevent all of these thousands of excess mortalities that occur every year in the US from heat. With that, Nick, I'll turn it back to you because I know we're really short on time.
Thank you very much. That was phenomenal. Our last speaker is Barbara Meadows. Ms. Meadows spent most of her career as a first responder and supporting first responders in EMS, firefighting, law enforcement, public health, and emergency management. So she's been involved with the Venn diagram, while simultaneously serving for 29 years in the Navy Reserves and the Army National Guard. She recently rejoined FEMA in 2022 as the Regional Planning Branch Chief in the Operations Response and Recovery Office. Over to you.
Thank you, Nick. I really appreciate it. So I'm going to go through this very quickly, but what I want to emphasize coming off of Dr. Eby's talk is that for FEMA, the climate change and equity are huge. And we can go ahead and go to the first slide and talk about that. So the FEMA administrator produced the 2022-2026 strategic plan. And as you can see in goal number 1 and goal number 2, it is now ingrained in the culture of FEMA that we instill equity in emergency management and also equity in climate resilience and making sure that the community is resilient. So what my planning branch does is we are responsible for developing the plans and working with the local communities at a regional level, all 10 FEMA regions, to assist them in big planning efforts for catastrophic disasters, and also to ensure that the federal government, the local governments, have the resources that they need when they respond. So the whole idea of putting climate change and particularly heat incidences into the catastrophic plans is important for us, so that we can not only look back at what happened in the past, but now we need to consider what happens in the future. And what are those vulnerabilities that need to be addressed when the federal government and FEMA comes to help respond. Let's go to the next slide. It's a really challenging thing to do to decide how you are going to respond to a crisis or or an emergency disaster when really we haven't in the past looked forward in terms of where those vulnerabilities might be. So there's 2 different ways that we do planning, and that's for deliberate plans and crisis action plans. The most important thing that we do is those deliberate plans. These are plans that they take a very deep look into whatever that actual emergency or disaster may be, and those cascading impacts that happen. And heat emergencies is one of those cascading impacts in many of these large catastrophic plans. So the 2 plans that I have highlighted for you is pretty typical for for FEMA, as well as for local, county, state, tribal, territorial governments to develop plans where you have the ability to pull out an operational annex, and you can work with the things that may be those cascading effects in a catastrophic situation. So for FEMA regions, and I'm coming to you from Denton, Texas, which is Region 6, at a federal interagency and state conference where we are working on planning efforts, particularly for hurricane season, and also what are those cascading impacts that happen. So a catastrophic plan, we're talking about things like hurricanes, earthquakes, radionucleological incidents, but the main overarching plan for most emergency management agencies is the all hazards plan. The all hazards plan addresses the bottom line, how do we respond? It tells you, what the oversight is in an emergency situation, what are the coordinating instructions, and how do we communicate in those situations. And there are specific appendices that talk about things like task organization, how we receive intelligence and information, operations, logistics, communications. But also there are incident specific annexes, and these hazard specific annexes may include things like a power outage annex, a biological annex. They are based on what those regions, those states, those communities see as some of their high level, high impact, high frequency situations that they may have to address. So let's skip to the next slide. So this is where we are inserting heat risk, and as well as looking at what is the climate change doing that changes our planning process. Just like Dr. Evie said, we need to be able to know how we're going to coordinate. We work with a federal interagency with emergency support functions, coordinated through FEMA for response, as well as helping with the funding for response. So when we go through a planning process, and we are emphasizing that there is a full 6-step planning process, step number 2, which is understand the situation, whether you're developing your all hazards operational plan or whether you are developing an incident annex. That's where we do information analysis and determine what those threats are, what the level of the threats, risk indexes, and where are the people, and how do we need to respond in an emergency. This is the mainstay of planning. And we at FEMA are working very hard to instill climate change and equity into this information analysis step. So that's a support for all emergency managers. I saw something in a chat about emergency management. And this is how we are helping our communities through federal government to support that type of planning effort and help provide some resources to do so. So I'm going to jump back. I know my time is cut short, but I'm happy to discuss this with anyone. And if you want to, send me emails and we can have discussions later. I appreciate it. Thank you.
So I want to thank the panelists for this. Our contact information is in the cover slide that we sent around. This was a phenomenal panel. Obviously, we could have spent all day talking about the topic. But having said that, good things must come to an end. So I'm going to hand it back to Morgan, and thank you all for listening in today. Thank you.
Thank you so much, Nick, Brendan, Barbara, and Chris, for such an amazing panel. This session was so incredibly inspiring and moving. We're just an hour into our meeting today. So now we are going to be moving into our next session. How can we better prepare for and manage the cascading impacts with heat? We have another fantastic lineup of federal and state local presenters for you today, as well as some opening remarks. So to open the session, I want to introduce the moderator, Dr. Thomas Osborne. Tom is the director of the VA's National Center for Collaborative Healthcare Innovation and Chief Medical Informatics Officer at the VA Palo Alto Healthcare System. He is leading the development of pioneering healthcare solutions throughout the VA with other government agencies and with leading technology companies. His mission is to deliver the best and most advanced healthcare solutions to our veterans. Dr. Osborne is the inaugural recipient of the VA Undersecretary for Health Robert L. Jesse Award for Excellence in Innovation, as well as multiple other national awards. His work has been published in numerous medical journals and textbooks on topics such as predictive analysis, artificial intelligence, sensor technology, augmented reality, virtual reality, and the future of healthcare. Dr. Osborne received his medical degree from Dartmouth Medical School before completing residency and fellowship at Harvard Hospitals. Off to you, Tom.
Oh my gosh, Morgan, thank you so much. What a awesome introduction. It is an absolute pleasure and honor to be here. And thanks for the opportunity to be part of this event and to share, also share a little bit of our VA perspectives on climate and health. I'll do that a little bit and then we'll get into the panel. We have an absolutely amazing panel. And, you know, I agree with Nick earlier. I mean, geez, that panel was awesome too. It seems like all of these topics we could talk about for a long, long time. But as you said, Morgan, one of my roles at VA is director of NCCHI. And our perspective is very much what this whole program is about. Our goals, our mission is to bring together diverse perspectives, tools, and resources so together we can build the healthcare system of the future. And the VA is the largest integrated healthcare system in the United States. And so we've got quite a bit of responsibility and even opportunity with that and the things that we can do at VA because we have this depth of responsibility and broad reach, you know, potentially is also applicable to people throughout the country and the world. You know, in particular, our patients are also at increased risk for a lot of these climate change hazards that we've been talking about. Our population tends to be older, tends to have more comorbidities than the average population, live in rural communities, and many are dealing with economic hardships. So the challenges that we have here at VA are very applicable and perhaps more acute than you might have in some other communities. So we also have an amazing national database, and we've been working with some great partners, great friends, also in this meeting from CDC and NOAA to better assess and predict how we can understand what's going on so we can better serve our veterans and hopefully our country at the same time. So with that, I'm open to collaborations, but I'm going to get into this cool panel. Enough about me. So I'll briefly introduce the kind of panel format here. It's going to be both federal, local, and state expertise from all over the place. We have, just like I said, amazing people who are dedicated and mission driven to serve our country and our citizens. So it's going to be fantastic to hear from them all. Just one disclaimer though, this discussion we could have a whole meeting about just this topic. And, you know, we understand we cannot represent all of the different nuances and components of this, but we're going to get into as much as we can with the limited time. And to kick us off, my gosh, Vicki Aurora is going to be our keynote and to get us all oriented. I was looking through her bio. She has done so much amazing stuff. So it's a great privilege to introduce her. Vicki Aurora currently serves as the Associate Administrator for Policy at the U.S. Environmental Protection Agency. In this role, she oversees a diverse portfolio that includes regulatory, policy, management, environmental justice, and climate adaptation, environmental economics, community revitalization, and EPA, and more. So I'm super qualified and very knowledgeable. For 12 years before that, she served as the Executive Director at Georgetown Climate Center. She was also professor at Georgetown Law, Director of Environmental Law and Policy Program. Oh my gosh, is that not enough? Aurora, she also oversaw Georgetown Climate Center's work at the nexus of climate and energy policy, supervising staff, students, and climate mitigation adaptation at the state, federal, and local levels. Okay, so that's not enough, but earlier in her career, she's also director for the Pew Center on Global Climate Change and Domestic Policy Program. She did that over for a decade. It is a great privilege to introduce you, Vicki, and to share some of your insights and knowledge with us. Take it away.
Thank you so much, Dr. Osborne. And it's really a pleasure to be here and to see so many friends on this program and to learn from you all. So thank you for this opportunity. to be alongside EPA's federal partners, as well as state and local actors who are on the front lines of addressing the dangers of extreme heat. Extreme heat, of course, is just one of the many ways that we're seeing very real impacts of climate change. And as you all know, heat waves don't show up alone. They also contribute to and are associated with often drought and wildfires. They can also occur during and after storms like hurricanes. And the impacts of heat, when they come at the same time as these other disasters, are immediately following, when the power goes out or wildfire smoke makes it so that people can't open windows, can be especially devastating, especially in terms of public health. And I know this from my own life experience and my family's experiences. I grew up in New Orleans and have family who still lives there, most recently affected by Hurricane Ida, which of course killed more people in that area of the country from the heat than the storm itself. And my own uncle in his 80s had to be helped down 10 flights of stairs as that heat wave continued, and went and took shelter at my sister's house, which was also without air conditioning for some time, but fortunately they managed to stay safe. Have also lost members of my family, and they've lost homes in previous storms. So this is not only an issue that I work on professionally as the adaptation lead for the Environmental Protection Agency now, and in my previous jobs, as you heard, but also I take very personally. And so on a personal level, I really appreciate all the leadership and engagement of all of you who are here on this call. As you'll hear from the panelists, it is so important, not just in its own right, but the cascading damages that affect all sectors of society and all aspects of our lives are something that we're going to see more of. Just one multi-day heat wave can lead to a loss of power, can lead to mental stress, poor air quality, transportation disruptions, even food supply disruptions. And so I think it's safe to say that heat is not only the silent killer, but it's an unspoken but significant stressor on our overall quality of life. That's why it's so important for us to work together to develop solutions that address these interconnected effects, especially in the face of the intensifying climate crisis, where we know we'll see more frequent and intense heat waves, especially in cities, which often record higher temperatures than surrounding areas. We know that extreme heat, of course, also disproportionately affects underserved and overburdened communities, often communities of color and elderly populations more than others. And of course, a central pillar of EPA's work is to advance environmental justice and protect public health as we tackle the climate crisis. We strive to do this through our work on climate indicators, air pollution research, work on urban heat islands, and I see my friend and colleague Victoria Ludwig from our air office on the call, environmental justice tools and other areas. An example from our own Office of Policy, represented here also by Abby Hall, another wonderful leader in this space, is a new partnership with 4 communities to make sure that schools are properly cooled, to be safe places for kids to learn, but also for neighbors to gather during extreme heat events. And the good news is that solutions already exist to reduce damages caused by extreme heat. And you'll hear more about those from the panelists today. We know at EPA that our state and local government partners are facing urgent and environmental and public health challenges and are looking for solutions that cut across all of them. For example, the Humble City Park, there's one in New Orleans that I grew up in walking distance of, literally called City Park, and they provide many benefits, as you know, and they also help to mitigate many risks. With trees and greenery in the middle of a heat wave, it cools our bodies, it captures smog, it calms our minds, it reduces neighborhood temperatures, which in turn eases pressure on the electric grid. And many federal and state and even philanthropic partners can support citywide green infrastructure projects that bring co-benefits, including creating cooler neighborhoods. EPA's own water infrastructure funding through the bipartisan infrastructure law is just one source of funding that can go towards such local projects. So we at EPA are very excited to work with you all through NIHHIS to help all sectors of the economy plan for and invest in solutions to make our communities and citizens more resilient to extreme heat. Thank you for the opportunity to speak today and to join you, and for all you are doing to keep people safe and cool in these unprecedented times. This panel is an exciting opportunity for us to work together to make the US and its citizens safe and cool. Thank you so much.
Vicki, thank you, man. I think there's so much we can learn from you and your experience and collaborate together. Thank you for your inspirational words. We're going to jump on to the panel here because we have limited time. So every panelist will have about 7 minutes. It's not going to be enough for us to do justice to all the great information they can share with us. And we have a diverse representation. This will be kind of a Q&A format, and we're going to be moving fast to cover all of the stuff in a compressed timeline. So the introductions will be quick, but like I said, we'll do no justice to the backgrounds and experience of this amazing group of service-driven, inspirational leaders. To start off with, Kristen Fine, Director of HHS Empower and many other things. Kristen, you and your team have been leveraging federal Medicare data to increase community awareness about electricity and healthcare dependent at-risk populations, and specifically those who are impacted by acute climate emergencies and those who happen to have prolonged power outages, much of which we've talked about earlier. Tell us about how that data and the tools that you use are helping communities to prepare and take action in an emergency like this.
Thanks, Tom. Happy to do so. Next slide. To begin, advances in technology and healthcare service delivery have better enabled at-risk individuals with access and functional needs to live independently in their personal homes. Well, millions, particularly older adults and those who are chronically ill, rely upon essential healthcare services, including oxygen, dialysis, and/or life-saving and maintaining electricity durable medical equipment, also known as DME, such as ventilators and concentrators. Local instances such as extreme heat and other disasters with prolonged power outages can disrupt their care and rapidly thrust them into life-threatening situations within hours or days. In 2012, public health and emergency management officials, healthcare organizations, and others commonly reported that they didn't have access to timely information that could help them better address the needs of at-risk individuals in their immediate communities. To help, in 2013, we piloted a novel first-in-the-nation exercise in New Orleans to assess and ultimately confirm that Medicare insurance claims data could actually inform and support a public health authority and their partners to help plan for, respond to, and support life-saving outreach in the event of an incident, emergency, or disaster. Building on this success, ASPR, in partnership with the Centers for Medicare and Medicaid Services, launched the Hhs Empower Program to provide federal Medicare data, mapping and artificial intelligence tools, training and resources, and also to help communities nationwide protect the health of at-risk Medicare beneficiaries, including 4.4 million who are dependent upon 14 types of DME and also healthcare services and live nationwide. The program strives to provide readily meaningful, consumable, and actionable data to ensure the right person has the right information and at the right time to take action. Next slide, please. For example, leveraging our monthly updated publicly available de-identified data, whether by accessing the Empower map or consuming our API REST service or using our Amazon Alexa or Google virtual assistants, community partners can use this public data to help inform and support their emergency preparedness, response, recovery, and mitigation activities. While Empower doesn't represent all individuals, it does reflect the majority of older adults and some others as well that are high risk, and can provide information to inform at least a baseline planning scenario that include, but are not limited to, informing shelter needs and resources, anticipating evacuation assistance, prioritization of power restoration after an emergency or disaster. Also, we have innovated further we realize that we don't include everybody. So we've actually developed and launched an empowering state Medicaid and CHIP data pilot that states and territories can participate in voluntarily and build partnerships between their public health agency and their Medicaid agencies to develop similar data capabilities in Empower, and also to be able to then use that state-operated data to identify other at-risk populations, adults, and also children too. Next slide, please. So how is this data working? Through the expanded other types of restricted data that's represented in Empower, public health authorities and their first responder partners and others can inform and support targeted planning, response, and recovery activities, including life-saving outreach assistance in a disaster. For example, Los Angeles County, the largest county in the nation, includes 88 cities and a diverse population of over 10 million people, and faces many hazards from extreme heat, wildfires, mudslides, earthquakes, and other severe storms with high winds that have also led to severe power outages and or triggered most recently the implementation of public safety power shutoffs to reduce the likelihood of ignition of wildfires by critical infrastructure. How they've used this data, they've actually gone and, for example, in the 2017 wildfires, they were able to leverage this information to make contact after the historic wildfires to actually connect with their DME and oxygen suppliers to provide recovery assistance to over 600 individuals in the impacted zone. In 2018, in the Woolsey fire, this data actually helped inform first responders in developing evacuation planning scenarios and rostered 100 law enforcement, accessible transportation providers, and had EMS on standby. They've also since institutionalized this amongst multiple first responder, emergency management, and public health agencies at the county and city so that it's readily being able to be operationalized in 30 minutes. This data can be turned into products to support first responders racing to the scene in a wildfire. This data has also been used countless times with them to help also inform extreme heat with power outages. During those events, have rapidly expanded their capacity to reach out and have actually called over 2,000 DME suppliers and home health and hospice providers to alert them about predicted power outages, excessive heat risks, and resources for their clients, and recommended they contact their clients to encourage them to plan and implement personal preparedness measures and to provide information about cooling stations as well. This data, similarly, building on those capacities, and I think this is the important thing, is that each one has to help them learn about other ways, and that they've been able to leverage the same capabilities to help flooding and mudslides, water quality emergencies, and even now, most recently, the first responders have leveraged utilizing this data in support of homebound COVID-19 vaccination outreaches. By the work that they did in extreme heat and wildfires led them to being able to vaccinate older adults. Next slide, please. So I always believe data shows, and we really need to be led by the data. LA County's innovative data-driven strategies were also leveraged by many of their local peers across the state of California and has since been integrated in the state's dashboard as well. In 2019, local officials were faced with nearly no notice implementation of public safety power shutoffs, PSPS events that they're referred to, across the state. And it was following the 2 historic years of wildfires. It was done in, again, effort to reduce the likelihood of wildfire ignition from critical infrastructure due to wind and extreme heat. On the left, you can see where the wildfires were taking place during the year of 2019. And you can also in the middle see where the utilization of our Empower map, our public data, was being used. It corresponded to the wildfires, and also through other data sources, we were able to see it corresponding directly to PSPS events that predominantly took place, the majority of them in October and November. And one of the worst weeks of PSPS events, in October 6th to 12th, the map had been used by 145 unique users. So we saw individuals taking this data and using it. This example is just one of many from across the nation and a broad variety of disasters, many of which are commonly also accompanied or caused by extreme heat. All of our collective work from the federal to community level is imperative to advance understanding, prioritization, and to take action to help our communities, and particularly at-risk populations that have historically and disproportionately adversely been impacted by incidents, disasters, and emergencies. Additional information about Empower can be found on our new HHS Empower Program platform and website. We look forward to continuing to partner across the interagency of our federal partners and also with our state and locals. We know that the response starts locally, and the incredible work that's being done in communities across the nation to do so. Thank you again for the opportunity to participate in this panel and conference. And I look forward to hearing about the incredible work from our fellow panel participants, federal, state, and local today. Thank you.
Oh man, so much information, so much amazing information. Thank you again for that. Next on our list is Eric Stevenson, Dr. Stevenson. Unfortunately, he's got a little bit of an obstacle he's dealing with. So my good buddy Paul's going to fill in, representing CDC, also NIH and HHS. So Paul, if you're available, You, Eric, and others on your team have been deploying strategies to help our citizens to rapidly adapt to acute climate emergencies. Tell us about this critical work that empowers the public to have improved agility in these situations.
All right, thanks, Tom. Can you hear me?
Perfect.
Okay, working on getting my video up. Apologies, I'm stepping in for Dr. Svensson. He should be able to join shortly, but for now you'll hear my voice without seeing my face until we get that started up. So today I'm going to just quickly be covering some of the work that CDC has been doing on this, but especially for communities around the country, because the work really is happening in local communities on the ground. 1 second, checking for video. All right, might have to troubleshoot that later. Next slide, please. So I'm not going to spend time on this slide because we've seen this throughout the yesterday and today. The one thing that I will say is that we know that these numbers are undercounts. This is what is, for example, marked on death certificates, and we know that that's not a full count of the true cost in terms of human lives. But we've heard quite a bit about that today, so I'll go on to the next slide. And transitioning into some of the things that CDC has available to address this issue. Next slide. So the Heat and Health Tracker has been brought up a few times throughout this NIHHIS meeting because it originated from NIHHIS. This is a collaborative effort that includes CDC and NOAA, and it's designed to give actionable information to officials that are working to protect health during heat waves, for example. So there's a lot of great information on here. And if you haven't seen this, the link is in the chat. And one thing that I want to highlight is that it has county level information. So you can enter in your county or your zip code, and it has specific information about heat where you live, including populations that might be disproportionately impacted by heat. Next slide has a few of the updates that we are planning on this. So there's a lot of things already on this Heat and Health Tracker, including a monthly forecast that we've heard about during this meeting already, but we're continually adding to this. One way that we're doing this is through adding more precise heat-related illness data. So currently there is syndromic surveillance of heat-related illness, and we are refining that down to a daily level. So refining it in terms of timing. We actually have this operational internally already and hope to launch it by the end of May. So that'll really allow people, again, to look at where they live and see what the rates of heat-related illness is in where you live, but on a daily level. So that refined scale might really help with planning and to get the picture of what's happening and how heat is affecting an area on a near real-time basis, at least daily. And this is a collaboration that CDC's Climate and Health Program has with CDC's National Environmental Public Health Tracking Program and the National Syndromic Surveillance Program. So even within CDC, it's a big collaboration, but then of course, collaborating with other partners and especially NOAA and National Weather Service on this. The other thing that will be added and is currently being constructed is better heat wave forecasts. So right now what we have on there is monthly forecast. So you can go in right now and see for May in your county, is it expected to be hotter than normal? And it will give you the expected number of extreme heat days as compared to the climatology that you normally would see in your county. So we are expanding this to include a number of things, including a seasonal forecast to help jurisdictions plan, for example, for the entire summer, to adjust their communications, be ready to roll out cooling centers, et cetera. So we hope that this, as well as other things that we plan on adding, will be useful to a wide audience. Next slide. So I also will briefly mention that CDC has a number of other tools for climate health, data, videos, resources, et cetera. I won't go through all of these, but if you'd like to see what we have, just check out cdc.gov/climate and health. There's a broad array of things for climate change in general on here, but quite a few things on heat in specific. Next slide. So I'll talk just about a couple of publications we've had to help add to the science behind this. Next slide. These are a few things we've done to look at the health impacts. On the left is a study we put out last July, just a couple of weeks after the major heat wave that we heard Chris and Brendan talk about earlier in the Pacific Northwest. So we used syndromic surveillance data and were able to very quickly summarize and publish some of the heat-related illness emergency department data, which of course was a massive spike. For example, one of the days saw a rate of heat-related illness 69 times higher than expected. So we were able to use syndromic surveillance to quickly look at this problem. And then on the right, you can see a paper on methodology that we developed for looking at heat-related deaths. Next slide. So we also are looking at incorporating health data into different climate and weather and heat metrics. And you might have to advance one more time to get the image to show up on the right. There we go. So on the left is some studies done by Rish Vaidyanathan in CDC's Climate Health Program, looking at where across regions in the country, at what temperature do we actually see these health impacts? So in the Southwest, it's a higher temperature, air conditioning prevalence, or people being used to the heat. We've done that. It's been a multi-year project, and there is an experimental heat risk that's already operational for the Western United States that does incorporate this health data. Plenty of more data on that, but we're going fast through this. So please do reach out if you want more information on this, or visit that website for the Western United States. Next slide. So just two more quick things on heat adaptation and how we're supporting communities. If you go to the next slide, you'll see a map of CDC's climate grantees. This includes current and previous grantees, as well as a number of mini grantees we've done in partnership with organizations such as the National Indian Health Board. The majority of these are working on heat in one way or another. So this is one way that we get resources out and actual funding on the ground to help communities prepare for and respond to the health impacts of extreme heat. And then the final slide is an example from New York City on this, where we funded them for climate and health. And one of the projects they put in place was called Be a Buddy. It was a program that strengthened relationships between residents and local organizations to reduce vulnerabilities to extreme heat. And this was targeted in low-income communities. Basically what it was is essentially check on your neighbors. And it was an organized thing to get those resources and build those relationships in communities to help protect during heat waves. So that, I know that was really quick lightning tour, but lots of great things that our partners across the country have been doing on this. The last slide just has some contact info, and thank you.
Fantastic, Paul. Paul just jumped in out of nowhere, not expecting to do this talk, and did an amazing job. Paul, thank you so much, and really impressed by the work you guys are doing, in particular, being able to predict and forecast what's going to happen or potentially going to happen has a real positive benefit as we can react ahead of time. So really, really important stuff. Maggie, Jerry, so cool that she's here. She has been doing tremendous work with mental health as it relates to emergencies. Maggie is the emergency coordinator for the Substance Abuse and Mental Health Services Administration. She works within the agency and across agencies, HHS, diversity of really important topics related to mental health and substance use disorders and emergencies, and has a particular focus with climate change. So, Jared and Maggie, tell us a little bit more about what is at the forefront of your work right now related to extreme heat and mental health, and fill us in a little bit about your interrelated and coordinated approach to addressing these vital topics.
I will try my best. I did select not to include slides in this presentation. Can you hear me? I just want to make sure that the sound is
Fantastic.
working. Wonderful. So thank you, Tom. It's a pleasure to be here today with colleagues and everyone participating in the NIHHIS National meeting. First, for those who may not be familiar with SAMHSA, I just want to take a moment to share that the Substance Abuse and Mental Health Services Administration, SAMHSA, is the agency within the U.S. Department of Health and Human Services that leads public health efforts to advance the behavioral health of the nation and to improve the lives of individuals with mental and substance use disorders and their families. As was noted, as the emergency coordinator, I work with staff and subject matter experts across SAMHSA to establish and maintain collaboration between SAMHSA, other government agencies, and non-governmental agencies in support of behavioral health for communities impacted by disasters, public health emergencies, and mass trauma events. On the topic of mental health and changing environments, there's a lot to discuss on how these intersect. For anyone who maybe didn't have a chance to listen to yesterday's presentations, I encourage you to look at the videos that will be posted. Juanita Constable's presentation yesterday provided an excellent overview of heat health risks for several populations, inclusive of mental health. We seem to be in a watershed moment where the effects of environment on mental health is becoming a topic of interest in a broad number of professions and industries. Waves of literature have emerged in the context of the COVID-19 pandemic, for example, bringing attention to the psychological impact of isolation on people, increases in the loss of life of people through mental health and substance use conditions, including through overdoses, suicide, and alcohol-related deaths. And recently, additional waves of literature are emerging, highlighting the evidence and substantiating what many of us observe in ourselves and in our own lives, that people's mental health is impacted by the effects of environmental change. When I think about the amount of data that is surfacing related to the broader public health, mental health effects of changing environments, and I have asked for a link to be dropped on an infographic called Climate Change is Affecting Our Mental Health. When I think about the amount of data that just comes through my work life on a daily basis, or what people might be hearing in the public, even in the news, I have a flash memory of a New York Times op-ed that I read many years ago in 2007 called Save the Darfur Puppy. In the op-ed, the author, Nicholas Kristof, presented evidence that people are more likely to donate or take action to help in a situation if they think they can help one person. They're less likely to donate or take action if they think they can help two people, and they're even less likely to help if they think they can impact thousands. As he puts it, evidence is overwhelming that humans respond to the suffering of individuals rather than groups. I would add to this that I think people respond when they believe there's something tangible within their grasp that they believe they can do. This applies not only to each of us as citizens in our daily lives, but also in our work lives, in the parameters of what we think we can do in a certain profession or a certain organization. So the point of the Darfur Puppy op-ed relates to the broader mental health concerns we are seeing today related to extreme weather events, prolonged heat, and changing environments. And it also relates to the process of working collaboratively across agencies to develop new resources and new ways of doing our work in these emerging and often novel heat events. In essence, statistics help galvanize some audiences, but for broader mental health concerns, people need to know that actions can be taken that make a difference in at least one person's life, and that matters. So I could present some alarming statistics, and I'll touch on a few. Some of those statistics likely come from your own work. For example, a July 2018 literature review on associations between high ambient temperatures and heat waves with mental health outcomes highlighted significant gaps exist in our understanding of the impact of heat on mental health. Literature also showed strong evidence for increased risk of suicide in high temperatures and evidence of risk of hospital admissions for mental health in increased high temperatures. On Monday of this week, I was able to listen to the 6th annual Arizona Extreme Heat Planning Workshop, where Laura Fox, who will speak shortly, and is also on this panel today, the senior heat epidemiologist for Arizona, presented statistics that are alarming to me. Of 551 people who died in heat-related deaths in Arizona in 2021, 42 were associated with substance use as a contributing factor. People, let me just say that also, there were also statistics shared that showed increased, of those who visited EDs at emergency departments, 27 had mental health disorders, 23% listed substance use, and for heat-related hospitalizations, 46 had mental health disorders and 55 listed 55%. So 46% had mental health disorders and 55% listed substance use. So with relationship to those types of statistics and the types of conditions people may have, I do want to also highlight Chris Eby's comments in the last panel on the importance of partnering with pharmacists, and we can come back to that in conversation, but I do believe pharmacists are important in helping people who may be on medications for substance use disorder and mental health conditions and understanding their increased risks and how they can protect themselves in heat emergencies. These are alarming statistics, but quite frankly, I'm aware of these types of statistics and they are not new to me. The challenge in my mind is that these statistics are very much on the radar of heat epidemiologists in health departments across the country, but may not be reaching behavioral health medical professionals, practitioners, and people with these chronic behavioral health conditions, many of whom have limited contact with healthcare systems outside of their treatment for mental health and substance use conditions. When we look at the broader public health effects of heat, discussions include the impact of sleep disruption, compounding effects of heat on general sense of despair, disconnection, and hopelessness, along with its intersecting social determinants of health factors. Therefore, solutions require coordinated and collective efforts across our agencies. I think it's probably something that people have on their minds, that people with serious mental illness and substance use disorder are disproportionately represented in emergency sheltering, transitional housing, and unsheltered populations. We also know that the Social Security Administration is one of the biggest payers for mental health related treatment for many people with serious mental illness. This indicates that many people with chronic mental health conditions also fall into restricted incomes, and that interplays with their ability to pay energy bills, choose safer housing environments, consider options for air conditioning, or consider backup plans when heat emergencies lead to blackouts. In essence, we cannot ignore the most vulnerable people with behavioral health conditions when thinking about broader public health concerns, just as we cannot ignore prioritizing development of novel approaches to support people and communities in retaining heat health. By focusing on the most complex or wicked problems before us, we build a stronger foundation for all of our efforts. I want to also highlight a few areas that are related to the concept of hope. First, when external pressure is extreme, it can lead to authentic collaboration to address gaps. And I think that's what we're seeing right now in our work collaboratively across agencies. Second, this is why I'm saying the statistics are very important, but when we're thinking about the mental health of broad communities, I suggest that in all cases where we discuss the mental health impacts of our changing environments, including extreme disparities for at-risk behavioral health populations and extreme heat events, it is important for people to know that actions can be taken to mitigate the effects of changing environments and that these efforts can be collective. In other words, no one is alone in facing these effects. We can face them together. Additionally, given the prevalence of mental health concerns related to despair, it is very important that data be coupled with emphasizing individual and collective agency related to how we adapt our lives and communities to retain wellness. Another link that I asked to be dropped in the chat is an article by Howard Frumkin that was recently published on hope, health, and the climate crisis. Frumkin points out that hope is measurable and can be operationalized. It often has three interconnected components, from setting goals to visualizing pathways to then feeling a sense of agency to take action on a pathway to a goal. Frumkin illustrates how hope has been a component of individual wellness and recovery from serious medical concerns, and that hope and hopelessness are far from just of clinical interest. Hope has long been a pillar of human existence. He explains why he thinks that this concrete concept needs to be operationalized in numerous areas of our work related to environmental health and change, including not only that hopeful people feel better than hopeless people, but also that the second reason is to propel hope is to lead people towards action. All right, so my colleagues here have asked me to speak just briefly also in a different area of my work life, but it's actually my training and my life outside of my career. And that is my training in seminary and in faith communities. So I'll just highlight there also, and it was mentioned earlier, the importance of partnering with houses of worship and faith leaders as one area of potential support to communities. But in the world of eco-theology and in the world of faith, there's quite a lot of dialogue about climate change, how to work with people in their understanding of thoughts like apocalyptic thinking, belief systems that they may have about the end of the world. And that's my cat, so you'll have to forgive her. She comes in sometimes and starts talking. So on that, I think it's just important to realize that whether we're talking about faith or not, we do need to think about what people believe, how they think about what they believed in the past, what they believe now, and how willing we are, all of us, to think differently when we think about the experiences we're having in the midst of our changing environment. So let me just highlight then, to close, a few areas of collaboration that SAMHSA is currently engaging in coordination with the HHS Office of Climate Change and Health Equity. We just published, and this will also be dropped in the chat, new areas in our resource library, the Disaster Behavioral Health Information Series Resource Center, which now has literature under climate change and under heat emergencies. We have just published a climate change dialogue online. That is a quarterly technical assistance journal that we promote through SAMHSA's Disaster Technical Assistance Center, also being dropped in the chat as a link. We anticipate publishing a climate change bulletin in August. And I do want to mention that we have a resource that is available 24 hours a day, 7 days a week, 365 days a year, called the Disaster Distress Helpline. This is available during heat emergencies. Callers are linked to counselors in over 100 languages, and ACL and sign language is available for translation. I will close with that, and thank you very much.
Maggie, thank you so much. A lot of amazing stuff you guys are doing. So much to talk about, obviously not enough time. Really appreciate you talking about the work you're doing with vulnerable mental health communities and faith and everything else. Fantastic. Next up, Eric Cheney, Clayman from our National Highway Traffic and Safety Administration, doing some really interesting work, creative work. So Eric and Clay, you guys and your team have tracked heat-related 911 activations during the 2021 Western heat wave and documented sharp increase in the proportion of 911 calls and other things. This is a really interesting angle to this, and also how it relates to other areas, California, Oregon, Washington, Nevada. Tell us, how can the National Emergency Medical Services Information System be used in real time to surveil community health impacts that are related to these environmental factors?
Hi, thank you. Can you hear me fine?
Perfect. Fantastic.
Excellent. You go to the next slide, please. So for the National EMS Information System, first of all, my name is Eric Cheney. I'm the project manager. I work for the Department of Transportation for the NEMSIS project. Dr. Clay Mann is the principal investigator out of the University of Utah who manages the project. So National EMS Information System, what is it? Basically, it is a data standard. What makes it unique and very helpful in situations like this is it is a national standard. Every ambulance service in the United States collects data pre-hospital the same way. Same definition for heat-related emergencies. We use ICD-10 codes. And regardless of where you are in the country, if you succumb to a heat emergency, every electronic patient care reporting vendor in the United States collects that data the same way. We even compliance test them to make sure that they do. So how does that help in this situation? Next slide, please. So how do we get the data? So a 911 dispatcher dispatches an ambulance. Ambulance arrives at the scene. They assess, treat the patient. Patient care report is generated. That data then goes to a local repository, if it's a county EMS agency or a private company. And then from there, it goes to the state. At the state level, they may take a little bit smaller subset of the data. They may not be interested in billing, for example. And then they pass a subset of the data from the state to the national EMS information system. We know and have recorded that that can happen in 7 minutes. So we're getting as close to near real-time definition as you possibly can. Next slide, please. So I said this is a national effort. So what does that mean in terms of numbers? So you can look in the chart and see from 2018, we were collecting about 22 million EMS activations from 43 states. In 2022, I'm happy to say we are just one state short of a complete census in this country of collecting EMS data. And we are right now, based on last year, about 48. We expect to get about 50 million records this year. Next slide, please. So I'll give you just an example, and I'm not sure if the video will play or not. There should be a little video that you can make an attempt at playing. This is showing motor vehicle activations, looking at a national level and then working our way down to the area around Atlanta. So you can see how motor vehicle crashes are occurring throughout the time of day. Imagine using this data for heat-related emergencies during the time of day and the hottest part of the day, or through certain episodes, periods of time where we have spikes. Looking at just the summer months versus winter months may be interesting as well. Next slide, please. So that gives you the idea of the near real time. So this is how we took a step back at the national level and looked at COVID. We can't go through a presentation without talking about COVID. Sorry, folks. But here we have COVID. We call this report EMS by the numbers. We looked at 2018 through 2022. It is important to say that the data that comes to the national level, we tell people we have 80% of all the EMS activations in the United States within 2 weeks. Now, in reality, we said that can happen in 7 minutes, but there are states that allow 30, 60, 90 days for an agency to submit data. So to play it safe, we tell everybody 80% in 2 weeks. So if you look at the red line, the giant spike that occurs there in red is 2020, that occurred in the 12th week, that is the initial spike of COVID. And if you see the gray shading behind it, that's when states started to put out stay-at-home orders. The governors were saying, stay home. And we tried to represent in about week 19, 20, when states started to open back up again. You see, we were on a pretty steady decline. Then you see kind of the salmon color vertical line there that shows Memorial Day weekend. Everybody got together. They were celebrating, hey, COVID, I think we got this beat. And then you start to see the little blip again, go out a little bit further to the kind of teal green line. And you see Labor Day weekend. And in 2020, that was the start of just an increase all the way through the end of the year. So this is just one example we wanted to show you. Certainly we could do this looking at heat-related emergencies. Next slide, please. So let's look at just counts. We're going to talk about counts, and they're important, but we also talk about rates in terms of the overall EMS activations. Because when we look at multiple years, I told you in 2018, we only had 43 states reporting. And in 2020, we have 53 states and territories. So to account for that, we look at rates. The count in this particular graph in 2021, you'll notice in June, we saw a pretty big spike, and that's related to the heat wave that was going through. And this graph represents only 5 states: California, Oregon, Washington, Nevada, and Arizona. And it's very important to point out that each one of these things, although we selected 5 states for this presentation, could be done at a state level or could be done at a county level if you have specific interests. So we saw the big spike in June of 2021. This is the count of 911 initiated EMS activations with patient contact. So, hey, we had a big patient contact increase. So what's going on? Next slide, please. So if we start to look at just what the paramedics coded as heat-related emergencies, we can see that same spike. And you see that go up in 2021. Now through the summer months, you see that represented in 2018 through 2020 as well. In fact, in 2019, a little earlier in the year, there was a pretty big spike, but by and large, 2021 set the record, at least for the years that we're looking at. So let's go to the next slide, please. How does that work out in terms of rates of heat-related emergencies? Well, this is the percent of the overall EMS activations. And if you noticed a little earlier, this is over about 105 million EMS activations across either 43 to 53 states, depending on the year that you're looking at. So this gives you an idea of how you can look at it at a national level. Again, you can look at this very specifically by state, by county, depending on who you ask. I do need to point out our data use agreements at the NIHHIS Technical Assistance Center at the national level allow us to go to a state level, but we cannot go beyond a state level for our federal partners. We have public access data cubes that are available for researchers who want to look at public access data. And we're happy to connect you to specific states of interest if that's something that can be of help to you. Next slide, please. What we did not build into this presentation, we actually started working with some of the people doing the planning afterwards, was what other things can you glean from this data? Well, certainly in this administration, age, sex, race are all very important. We can look at data by age, we can look at race, we can look at sex, and for the graphs that you see there, we actually did that. We did not submit them, but we have about a 56% white population represented in the heat-related emergencies that you saw there during the peak period. About 18% were African American, and then we had Hispanic following in at 8%. 63% of the time, the patients were male, 36% they were female. Another piece that may be interesting to like SAMHSA, if you're looking at the homeless population, for example, we can tell you the location the patient was encountered. So for all of our heat-related emergencies that we looked at there, 56,000 of those occur in the patient's residence. So the paramedics arrived, found this patient who had succumbed to a heat-related emergency in their home. The second largest value was on a street or highway, and that represented about, the third highest was street or highway. There's a private residence that made up another percentage in there. So again, there's just a robust amount of data available here. Remember, these are EMS activations. So these are the worst case scenario for heat-related emergencies. This was a case where someone thought this patient needed to be put in the healthcare system by ambulance through 911. So you're actually looking at the worst case scenario for this. With that, I will pause there, other than to say, we make this data available to the CDC through their CDC data hub as well. So for those folks that were participating from the CDC, happy to assist you with any research you're doing. Thank you, and we'll be happy to answer any questions when that time is appropriate.
Eric, fantastic. Man, this is really interesting work in many ways. One of the things that, from a healthcare perspective, we're also a little concerned about is, what about the missing data? If someone comes into the hospital, we're not always going to be coding them for heat-related emergency, and that's a blind spot for us. And the work you're doing really rounds out and complements so much of the other work that's happening. So really, really great work. We're going to shift gears a little bit. We're going to go to Laura Fox, doing amazing work at the Arizona Department of Health Services. Laura, you and your team have been tackling heat issues in Arizona, some of which may be generalizable to other folks outside of the state. Tell us about the historical trends that you're seeing in your area and how your teams are forging partnerships between state and local agencies to help solve these issues.
Thank you. Hi, I'm Laura Fox. I'm an epidemiologist supporting the heat surveillance work conducted at the Arizona Department of Health Services. Next slide, please. Within the Arizona Department of Health Services, the Environmental Public Health Tracking and Climate and Health programs work together to maintain and improve heat-related illness surveillance. Annually, we prepare public health statistics to characterize the burden of heat illness in Arizona by person, place, and time, using data sources such as death certificates, hospital discharge data, and syndromic surveillance data. On Monday, like Maggie referenced, we held our annual state heat planning meeting where we shared the most recent data available from 2021. And of most interest is the increasing trend in the number of heat-related deaths statewide since 2014, shown in the graph on this slide. The number of heat-related deaths has increased by 400% since 2014, when 91 deaths were recorded to a preliminary record of 551 heat deaths in 2021. And the majority of heat deaths in Arizona occur in males, are Arizona residents, white non-Hispanic, and are 55 years or older. In the last 5 years, about 30% of heat deaths listed substance use as a contributing cause of the death, and about 60% of heat deaths occurred outdoors from 2019 to 2021. Additionally, our programs track heat-related illness conditions seen in Arizona hospital facilities. From 2016 to 2020, there were an average of 3,000 emergency department visits and 750 hospitalizations recorded statewide for heat-related illness. And the population characteristics are similar to that of heat-related deaths, with the majority being male and white non-Hispanic. However, there is a difference in age groups among ED visits and hospitalizations, with the majority of younger adults 20 to 44 years old visiting the ED for heat-related illness, and middle-aged adults 45 to 64 years experiencing a hospitalization. Next slide, please. Our programs work with several partners and stakeholders in Arizona to communicate heat risk and enact prevention strategies. Supported through the EPHT grant, we share public health heat data in public-facing dashboards and reports on an annual basis. And this information is communicated through our annual state extreme heat planning meeting, which we held on Monday, where we partner with the National Weather Service, the University of Arizona, Arizona State University, county health departments, local and state government representatives, nonprofits, and others to discuss current work and future work in preventing the effects of extreme heat in vulnerable populations across the state and reducing its effects on morbidity and mortality. And supported through the CDC Brace grant, we have a large email listserv to communicate heat alerts and warning messages that are paired with the National Weather Service. And these messages contain information on heat risk and ways to stay safe. Currently, there are about 22,000 subscribers to our general listserv and 6,000 subscribers to our school listserv, and subscription is increasing every single year. We've also developed prevention and communication products for schools, outdoor workers, and older adult populations. Most recently, our program has partnered with universities, school districts, and CDC to develop a school heat policy guidance document in a pilot version to help schools and institutions develop a policy and implement best practices to prevent heat illness in their school communities. And we also partner with county health departments to support their cooling center networks, which are places where the public can go to get out of the heat that are often air conditioned and may offer water or water bottles. Next slide, please. Looking ahead, we plan to maintain heat strategies embedded in our current work, strengthen and expand existing partnerships, and with the recent grant funding award through CDC Brace to evaluate, prepare for, and build resilience against present and future extreme heat impacts. Over the next 5 years, we will partner with 2 county health departments to evaluate their cooling center networks and develop strategic plans that address climate and health issues. And additionally, we are working towards finalizing our school heat guidance policy document with school districts and universities, as well as enhance heat surveillance capacity by making data more available and digestible in public-facing dashboards and communication products. Through this work and our network of partners, we plan to work in a coordinated approach and strategy to address current and future extreme heat and health impacts in Arizona. And with that, thank you for your time and looking forward to our panel discussion.
Laura, fantastic work. I mean, it's just another great example of the great work you and your team are doing about the importance of data epidemiology to help us make important data-informed decisions. Robust work that you and your team are doing in a lot of different ways. So really appreciate your insights. Next, yeah, absolutely great work. Next, last but not least, Evan Mallon and Brian Stone have been doing a lot of great work on power outages research. Obviously really important. Without power and air conditioning, everything changes. So Evan and Brian, you and your team have been doing significant research to model trends with a focus on what we've talked about on the risk of power outages. And we've seen how this can lead to significant health consequences and that may be preventable, especially when you're talking about air conditioning and fans. So tell us about your work and the insights that you're uncovering that can help our country.
Absolutely. Yeah, thank you for having me. So my name is Evan Mallon. I am Senior Analyst with Georgia Tech's Urban Climate Lab. Today I'm going to be introducing some of the recent research that's coming out of our lab, and then I'll be followed by Dr. Brian Stone, who will be talking about some of the health impacts that come from the increased exposures that I'll be telling you about right now. So next slide, please. Thank you. So we are seeing increasing frequency and duration of power outages in recent years in this country. And with concurrent increases in intensity, frequency, and duration of heat waves, we have an increasing risk of having these occur at the same time. And so some of the recent work that we've been doing in the Urban Climate Lab is looking at interior heat exposure as a result of modeled concurrent heat waves and blackout events. So next slide, please. So I'm going to talk about 3 research questions that span a couple of papers that have come recently out of our lab. 1, how do building interior heat exposures change during a concurrent heat wave and blackout event for different residential building types? 2, how effective are cool roofing and tree canopy in reducing building interior heat exposures? And 3, how do building interior temperatures vary with the spatial intensity of the urban heat island and the various microclimates that it causes? Next slide, please. All right, so we did this in 3 different cities and 3 very different climates across the country, that for Atlanta, Phoenix, and Detroit. So I'm going to go into the results for each of those cities in turn. Next slide, please. All right, so a little bit on some of the methods, how we did this. For our first research question, how do building interior heat exposures change during a concurrent heat wave blackout event for different residential building types? We use coupled models here. We have both ambient temperatures that are modeled by the Weather Research and Forecasting Model, or WRF. This is how we tend to get downscaled climate data on a very high resolution in our cities, coupling that with an interior building energy model like Energy Plus. And then that way, these 2 models can work together for us to model what happens when we have the electricity on during a heat wave and we have working air conditioning. The next slide, please. We can model this across an entire city. So what we see here on the left, this is Phoenix, Arizona. We have a historic heat wave that we've modeled for each of these 3 cities. And we see what happens when we still have the power on. Next slide, please. And then when we turn that power off. So of course, we expect that we would have interior temperatures start to rise as a result. So we don't have that mechanical air conditioning to help cool us down. Next slide, please. We have 3 different building prototypes. We have 1-story single family, 2-story single family, and apartment buildings. A 3-story multifamily housing unit, we are modeling that top floor. So you can see here, this is going to be important in our results. We have this 1-story with a much larger roof area. It is a longer home, the 2-story being stacked. We have a smaller roof area to volume ratio. It's going to be important when I talk about some of our results. Next slide, please. And of course, we can test some adaptation strategies. How do we cool our families down inside our homes? We can use some adaptation strategies like cool roofing and tree canopy. Next slide, please. So just give a little bit more information about what this means. No adaptation means conventional roofing, existing tree canopy coverage in our cities. This is usually something like a dark asphalt roof. Cool roofing, we convert 100% citywide just to see what kind of impact that could have with an aggressive cool roofing strategy. And then of course, tree canopy, we have 50% tree canopy coverage over road surfaces. And we also include direct shading effects on our homes. Next slide, please. All right, for our third research question, how do building interior temperatures vary with the spatial intensity of the urban heat island? Of course, we can model this all across an entire city to see what this might mean in our warmer versus our cooler areas of the city. Next slide, please. All right, so here are our blackout impacts with our cities in turn. You can see that in Atlanta, as soon as we lose power, our 1-story single-family homes can skyrocket by almost 17 degrees Fahrenheit. And this happens only in a matter of hours. This is an enormous shift that our bodies are not prepared for. We very rarely will go through such enormous temperature swings. And when you do that, you'll really feel it. And this is where we can really start to have a major impact on our health. Next slide, please. It's even more so in Detroit, over 17 degrees of warming in our 1-story single-family homes as soon as we lose power. Next slide, please. And of course, in Phoenix, we have enormous impacts. We have our 1-story single-family homes and 2-story shooting up about 40 degrees Fahrenheit in a matter of hours. This is a gigantic shift in temperature that, again, our bodies are not prepared for. When we have such a huge shift in this temperature and so quickly, we don't have time for that acclimatization. We are not prepared for this shift, and our bodies really feel that kind of impact. So next slide, please. And a lot of this has to do with that building type. So I just mentioned that we had these 3 different building prototypes, the 1-story single family, 2-story single family, and apartment buildings. You can see here that our 1-story single family housing, this is for Phoenix, what I'm showing here, can heat up extraordinarily quickly and can heat up in excess of the ambient temperature. These are just like little solar ovens. That high roof area to volume ratio is going to soak up that sun, and it's actually going to be even hotter in your home than it is outside. Our models also assume that we have rational people living here and that we'll open our windows when it is hotter inside than outside. So even with that increased ventilation, we have this temperature that skyrockets above even the ambient temperature. You can see for our other 2 building types, it doesn't quite reach ambient on the inside, but it stays warmer at night. So it's going to cool off more at night than it does inside. And so we have what we call a bioaccumulation of heat in our bodies. When we don't have an opportunity to cool off, this is where we start to see those major health impacts over time. Next slide, please. All right, so what can we do about it when we start implementing some of our adaptation strategies like cool roofing and tree canopy coverage? We do start to see some significant cooling, even in absence of air conditioning. So we can see that for Atlanta, cool roofing is not as effective as tree canopy when it comes to just our 2-story single-family homes. We're also shading the sides of our homes. We have 5.4 degrees of cooling inside with that tree canopy coverage. For our single family with that larger roof area, the cool roof really does make a big difference. We can get almost 2 degrees of cooling passively using that cooling strategy. So you can start to see here that we have very different impacts that comes from these different strategies. So next slide, please. And then in Detroit, We have for those single family homes more impact coming from the trees. The trees are doing a better job of shading these homes. We have 8.5 degrees of cooling on that 1-story single family home. So we're starting to see that the context really matters. We have very different responses in very different areas in very different housing types. And this is going to influence our policy discussion we're going to have at the very end here. Next slide, please. And then, of course, in Phoenix, where we're just not able to establish and maintain this kind of overstory canopy that we can get in these other 2 cities, of course, we're going to see greater cooling that comes from our cool roof. 4.6 degrees of cooling versus 2 degrees of cooling with trees. We're just not able to grow the same kind of trees. And so cool roofing is really the strategy that we should pursue in a hot and arid city like Phoenix. Next slide, please. All right, now let's look at what these kinds of impacts have over the urban heat island, this differences in microclimates across an entire city. So traditionally, the kind of old paradigm that we've had is that this is how we talk about heat islands. We talk about hotter versus cooler areas of the city. What we're finding in this research is that the urban heat island penalty, which we define as the difference in interior temperatures between the warmest and coolest areas of a city within housing type, is not as great as the housing penalty. Next slide, please. This is what we're defining as the difference in interior temperatures between the warmest and coolest building type for each city. We see that the type of housing that you live in makes a bigger difference than where you live in the city on your interior heat exposure. So this really puts a magnifying glass on housing policy, really how we should be addressing heat. Not just in the hotter areas of the city, but in every area of the city and where we have particular housing types that are the most vulnerable. Next slide, please. All right, so the conclusions from our studies is that a concurrent heat wave and power outage can substantially impact indoor heat exposure up to 40 degrees for a 1-story single family structure in Phoenix. The roof area to volume ratio does make a big difference. And this is why we should really be targeting our strategies to housing types more so than just the hot spots, the traditional hot spots in a city, as we've talked about it for years in this field. Heat mitigation strategies effectiveness varies widely by city and housing type. There is no one-size-fits-all strategy. The housing penalty exceeds the UHI penalty in all 3 cities. This really does have an impact on how we should be addressing this from a policy standpoint. So next slide, please. So our recommendations for policy that come from these studies are that we need to prepare now. Cities should prepare now for concurrent heat wave and power outage events using both passive, like cool roofing and tree canopy, and active personal adaptation strategies, measures that we can take ourselves to cool us down. Housing matters quite a bit. We need to identify vulnerable populations by housing type for our most effective interventions, as we just showed. There's no one-size-fits-all solution. We really do need to have our strategies tailored to the local climate, that climate context, and the effectiveness may vary even by housing type. So we really do need to have this kind of study guiding these efforts for us to really make sure that our strategies are going to be effective and efficient, and most importantly, equitable. We need to look beyond these hot spots as we have for years. We need to implement strategies in warmer and cooler areas of the city, not just the hot spots alone. One final thing I'd like to highlight is that we talk about this kind of impact in a catastrophic concurrent heat wave and power outage event. But this really is the everyday lived experience of those who do not have access to air conditioning. And so we need to keep that in mind, that this is something that will impact them every time there's a heat wave until we can get a more well-rounded passive cooling and active cooling strategy comprehensively. All right, so I'm out of time. So I'm going to pass it on to Dr. Stone, who will talk about some of the health implications from this work.
Hello, everybody. Thrilled to be with you. Thank you, Evan, for walking us through that first half of really what we're presenting today that follows from the same research effort. I will we'll go ahead with the next slide, please. Try to keep us on time because I know we're at the coming up on the end of our time. So Evan was walking us through how we have measured these indoor heat exposures during a concurrent blackout and heat wave. And we're interested in this combination of both ambient exposures outside and inside, Obviously, during a blackout, it's those indoor temperatures that are going to spike. The outdoor temperatures don't change. And this really shifts us to think about heat exposure in a more comprehensive way than is typically possible with heat risk assessment studies, in the sense that we really want to know hour by hour, what is the heat exposure based on your location. So in addition to the modeling data that Evan was presenting, we also, for a small number of residents in each of these three cities, Atlanta, Detroit, and Phoenix, had wired up the houses and the individuals with individual thermometers to get a sense of how exposure changes, whether they are inside or outside in a vehicle. And so this is one sample of that we see for a resident in Atlanta in a household that lacks continuous air conditioning. Next slide, please. So I know this audience is well familiar with these dimensions of heat vulnerability, exposure sensitivity, and adaptive capacity. In this study, we're really trying to advance two of these three dimensions. Next slide, please. Around exposure, with this idea of individual experience temperature, moving from a single, often an airport weather station that represents the full city, to representing every single resident of a city and their hour by hour exposure, whether they are inside or outside. We account for socio-economic factors that drive sensitivity, of course, and then individual access to air conditioning. We usually do not have this data in a very reliable sense for every resident. And so we use a model here as well to get a sense of the likelihood of every household having either full central air conditioning, partial air conditioning in the form of a window unit, or no air conditioning. Next slide, please. So Evan was talking about the impact of these heat management strategies, such as cool materials and street trees. This is showing results for Atlanta. And again, this is just the ambient temperatures and how they are impacted across Atlanta. And you can see here that both of these strategies in the Atlanta context, both cool materials and street trees, can significantly lower those outdoor temperatures. So how is this then translating into building interior temperatures and ultimately health impacts? Next slide, please. We show this in terms of the building interior temperatures. This is both the power on and power off scenarios, just snapshots of neighborhoods in each of the three cities. And we can see, it's not surprising when we go into a blackout mode during a heat wave that most parcels, and in Phoenix, really every parcel, every household, is experiencing dangerous levels of heat exposure on the interior. But it's also really important to note that outside of a blackout, there are many parcels, particularly in cities like Detroit and Atlanta, that are experiencing very high levels of heat risk due to lack of access to air conditioning or unwillingness to use it due to the real expenditures associated with running AC and hot weather. Next slide, please. So Evan already covered this, so in the interest of time, we'll go ahead and go to the next slide. This is just the exposure we measured. So a key step for this project is to take it from the hour by hour individual exposure to temperature and extend that to heat risk in terms of heat-related mortality and heat-related morbidity. And so traditionally, this is done with relative risk. That's assessing for every degree increase in temperature, your risk of mortality or an emergency department visit, for example. In this study, because we are interested in exposures that are both indoors and outdoors, that often are exceeding the measured exposures from surveillance data, we really need to extend these curves. And so there's a lot statistically to unpack here, and we can talk about it more in the Q&A if we have time, but next slide, please. We're essentially taking each of these curves, actually prior slide, but that's okay. Each of these curves and extending them. And so this is not, we're using a set of response functions from Gasparini, the 2015 study that's widely used. But this is just to illustrate, we're essentially extending these curves forward into levels of exposure that are beyond what was measured in the original study. Okay, next slide now, please. So this is showing on the left the actual estimates of heat-related mortality during a 5-day heat wave and blackout. As Evan explained, we use a historical heat wave in each of these three cities. We model that both with power and without power. So we just assume that there's a blackout that's concurrent. That was not actually the instance in these particular heat waves. And so this is showing the actual counts of mortality that's estimated over those 5 days. On the right, we see the rates of mortality per 100,000 population. Important to note that Phoenix has been reduced here by a factor of 10 just to show it in the same graphical space because the numbers are so high. So 14,700 deaths are estimated through this approach, again, from a concurrent heat wave and blackout. The rate there becomes, when we adjust it, more than 900 residents per 100,000. So we're approaching 1% of the population we estimate would succumb to heat-related mortality during such an event were to happen. Next slide, please. This shows the same data, and then in the first two sets of bars, and then we add the heat adaptation strategies of street trees and cool roofs, and we see really a significant reduction here in both cases, ranging from 15% to a 70% in the case of Phoenix with cool roofs reduction in estimated heat-related mortality. And so there are many interventions we can consider here, but just looking at the built environment interventions of cool roofing and street trees, we can substantially reduce this heat exposure and risk of mortality. Next slide, please, during these events. This is looking at ED visits. We don't have a response function for ED visits in Detroit, so it's just Atlanta and Phoenix here. And here again, with Atlanta, we're seeing, while a relatively low relative to other cities, rate of mortality, a much higher rate of ED visits in Atlanta. So this is gets up above about 2% of the population during that 5-day simulated period. And then Phoenix, as we expect, is really off the charts. We've reduced this by a factor of 10 again. So what we're showing here is under the power off scenario, more than 100,000 per 100,000. So what that means is during a 5-day period, some residents would require an ED visit more than once. So this is really the full population of Phoenix at great risk of heat were this to transpire. And then street trees, cool roofs reduces that quite a bit. Next slide, please. Changing heat-related mortality by mid and late century, we look at the same percentile intensity of heat wave in the future with obviously projections of climate change driving those temperatures even higher. We see up to almost a 300% increase in Detroit. All of the cities, not surprisingly, are showing higher levels of heat-related mortality. Next slide. Wrapping up here with the last slide. So health impacts resulting from a compound climate and infrastructure events, many-fold greater than extreme heat event alone. Not surprising to see that. We find on average across the 3 cities, about a 20% reduction in heat-related mortality from street tree planting and a 40% reduction from cool roofs. It's an average across 3 cities. Could be higher or lower in each individual city. And the health impacts of a compound event likely to increase substantially in future time period. So with that, I'll conclude. Thank you for inviting us to present, and we're looking forward to discussing this further in the Q&A now.
Evan and Brian, man, fantastic. Really important discussion about sustainable architecture and heat resistant urban planning. Something that is just such a make sense kind of thing, but so much work needs to be done in this space. Really appreciate that. There is this last part of our panel where we will have some Q&A opened up, but this is sort of a reflection of this topic. You know, there's not enough time to talk about all the things we want to in this cascading impacts heat related discussion. We could have a meeting about this. You know, we have amazing work from all these panelists, and it's, I think for all of us, it's humbling to hear about your dedicated work and important efforts. I've learned a ton, but like I said, we have a little bit of time for Q&A. The first one that I see that has come up here on a side list, does Evan's study, this could be for Evan or Brian, does Evan's study include assessment of buildings, materials beyond the assumed asphalt shingle roof, brick versus wood versus aluminum siding, etc., or the color of traditional materials, lacking greater SRI, or the degree of wind exposure of the site? So pretty broad question, but really a lot of interesting points. What are your guys' thoughts about that, Evan and Brian?
Well, I'm happy to start, but I'll hand it over to Brian shortly. We did incorporate a wide variety of housing prototypes. We had, I think, between 40 and 60 different housing prototypes. It's things like masonry, non-masonry, basement, no basement, which direction does it face, things like that. And so we do have this data. We just have not had the time to analyze all of it just yet. And so I can't speak necessarily to wind, but I do think that airflow is an important factor. We do have active virtual people in our models, opening and closing windows as is appropriate. And so that has been incorporated. But Brian, is there anything you'd like to mention on our building prototypes?
No, I think you do a great job. I would just emphasize again, and again, we gave quick overview here. One of the papers from the study is referenced in the slides. You can access that if you're interested. We had a large number of building prototypes, but again, it doesn't represent the full diversity of what you would find in these 3 cities. But importantly, we do position every resident of all 3 cities in one of these buildings. We effectively create what we call a synthetic population. And so, census data doesn't show us precisely which house each individual is in. So we are forcing individuals into specific building types and situations so we can then assess what their heat exposure is based on their building type, their activity pattern, and what the outdoor temperatures are during the concurrent event. So thanks for the question.
Awesome, guys. Thanks. This one looks like it's for Kirsten. What are some of the worst case scenarios for major extended outages and needs to assist or evacuate nursing homes, et cetera? Some larger facilities have bus services on call 24/7, but smaller facilities may not be as well prepared or equipped. Kirsten, if you're still on, what do you think about that?
So one of the things that we did do is through collaboration with CMS on emergency preparedness requirements. Those factors started to really come to light, especially as the progression of different disasters happened over the past years with the climate change. And there were increases in responsibilities for making sure that they did have plans where those that don't have evacuation, they're required to have evacuation. So those factors are implementing. I can say that it does take time to filter through, especially when you're dealing with smaller facilities. And there's increased oversight of those activities, especially going in. Others are also trying to more proactively look at where there might be challenges or prior history or concerns from assessments in the past to try and take more collaborative approach in trying to make sure that they are taking steps to protect those individuals that are at high risk in a long-term care facility and can accommodate their needs, especially for electricity dependence and such. So they should have plans, they should have backup transportations. We also made sure that they also are required to look into also making sure that they're not all competing for the same group, that when they're engaged with their other planning efforts and their contracting perspectives, we've done this through many different types of guidance and trainings and such and engagement, that they also make sure that they are developing transparency and those that are actually contracting with them to make sure that they're not going to be dropped in the event of a disaster.
Awesome. Hey, there's another great question coming through. Thank you for that response. Laura, this one looks like it's for you. Do the heat deaths reflect migrant deaths along the border? Really important question, obviously. If so, where does the state get the death numbers from? And does it from Border Patrol or the FEMA County Medical Examiner's Office, things like that? What do you think, Laura? What do you know?
I can speak to the first part of that question. The data presented here was obtained from our state vital event registration system, which is basically data captured through death certificate. And this information originates from any death that occurred in the state of Arizona. So if the death occurred in the Arizona border, then it should be accounted for in this system, is my understanding. Who provides that information or registers that death? I have not looked into that specific to migrant deaths, but medical examiners any sort of death certificate certifier that registers a vital event, I think contributes to this data. Tom, you're muted.
I'll get the hang of this eventually. Thanks. That's a really important point. I mean, there's obviously a lot of people that are crossing dangerous territory to come to the US, and we may never know until, there's, maybe belongings of someone that's found later. Next topic, next question. The question here, this is a good one. I would like to see US territories incorporated more into these models, particularly the EPA heat index site. What capabilities are needed to get that? This is for anybody. Maybe from the CDC. Anyone from the CDC on that might have some insight on US territory data? It's a mystery.
Hey, sorry, I was muted by the host. So,
oh no,
I'm unmuted. So yeah, I can check into that. I know in some of the studies that we've used on both heat-related morbidity and mortality, there is sometimes a lack of data for some areas, and that definitely includes some freely associated states and territories where some of that data might not be readily available. There are a number of other data concerns around that as well. For example, some of the data that's reported into CDC does not include Indian Health Service healthcare centers or Veterans Administration healthcare centers. It depends on the data set used. So that's one of the reasons we know that heat-related deaths and sometimes different heat-related illness data is underreporting because it's in not necessarily a complete data set, not necessarily including all geographic regions, and also in some cases can be suppressed. So definitely a data issue, but there are a lot of surveillance programs and state health departments that are collecting some really good data. It's just important that we realize that some of that can be an undercount.
Paul, thanks. That's great. And I think we could go on forever probably with these questions and all these insights. But we're already bleeding into the break time. We're going to cut this off, even though I'd love to talk and hear more about this. Everyone, panelists, questions, everything was fantastic. Everyone get a virtual round of applause, standing ovation. I really enjoyed this. I learned a lot, and I look forward to hearing more and collaborating with you all in the future.
Thank you all so much. That was such an incredible panel. And thank you to Tom for moderating that panel as well. And to Vicki Aurora for opening remarks. That was such a great panel of tools, resources, and perspectives on how we can address the cascading impacts with heat. And with that, we are going to take our first break of the day. Sorry for going a little over on that one. We hope that you will join us again at 3:15 Eastern Time for our session on communicating the heat health problem. Again, during break times over the course of the meeting, we're going to be using Mentimeter polling for heat trivia questions and words clouds. And so with today's word cloud, I'm going to put that in the chat in a second, but it's going to be related to the panel that we just saw here. So when we return from break at 3:15, we'll discuss some of the results we see. See you all then. Hi, everyone. Thank you so much and welcome back. Thank you to all of you who filled out the Mentimeter poll that we had in the chat. You can keep putting it in as we're discussing it here, but just wanted to go over some of the impacts that the people who are attending this meeting are concerned about in their communities. And the biggest one in the center that we're seeing is death. We're seeing climate change, social justice, infrastructure damage, hospitalization, quality of life, homelessness, energy costs, energy consumption, being isolated. We're seeing equities. I mean, there is just such a wide range of different impacts with heat. And so thank you all so much for putting your input in. And we hope that we can be addressing, working together to address all of these issues. So thank you so much. Stop my screen share now. All right. It is my pleasure to introduce our next session. We are going to be talking about how we can better communicate the heat risk. This session will feature 4 presentations from speakers who are actively involved in this field, and will feature Q&A towards the end of the hour. Again, if you have any questions to ask our panelists, please add questions to the chat. And with that, I'm going to turn it over to our first speaker, Danielle Nagel. Danielle is the Public Program Coordinator at the National Weather Service Analyze, Forecast, and Support Office. In this role, she develops policies to enhance the service capacity of National Weather Service for hazards such as extreme heat, high winds, and dust storms. Danielle previously worked within other National Oceanic and Atmospheric Administration offices as a social science contractor and the National Academies of Science within their Resilient America program. She holds a bachelor's and master's degree in meteorology and earned her PhD in disaster science and management from the University of Delaware. Off to you, Danielle.
Thank you, Morgan. And let me confirm that my audio and visual are working okay. Please let me know if they're not. Okay, great.
Sounds good.
All right, you can go on to the next slide. So to begin, I want to give a brief overview of some of the things we're doing internally within National Weather Service to promote heat communication and awareness. And it leads a little bit into some of the NIHHIS work I'm going to talk about. So to start off, we do seasonal safety campaigns at the beginning of each season, so 4 times a year. And they provide a package of information such as infographics, videos, social media posts, and images that can then be used widely for both internally, but also externally with our partners for awareness of a variety of hazards. So obviously heat is in the works for spring and summer, and you'll see the summer one coming out on June 1st. And then down at the bottom there, you see our heat safety webpage, a screenshot of that. And we actually did a lot of work to revamp this last heat season, last year. One of the things we adjusted is actually highlighted there. We are focusing on a variety of vulnerable populations related to heat. And we've been hearing about that quite a bit during this meeting. And so we chose to highlight a set of 5 of them and describe why they're vulnerable to heat. So you can see that and much more on our webpage. I also want to highlight one way that we've collaborated with other federal agencies, and I'll definitely be going into more collaborations in a moment here. But we've collaborated with OSHA several years back to include specific language within our heat advisory and excessive heat warning products. So you'll see a sample of that in roughly the middle of the screen there. And then also, I just want to quickly mention that we are active on social media, Twitter and Facebook, both from a national and local level for heat awareness and also leading into heat events. Next slide, please. So NIHHIS, what does this have to do with NIHHIS? Well, National Weather Service was looking into potentially revamping and updating our heat-related illness graphic for this coming season. And you'll see the original down in the bottom middle of the screen. And we really called on NIHHIS to help us convene federal health experts for guidance on how do we update this? What's the relevant science out there at this point? It was such a success, and we had such interest that this NIHHIS subgroup actually evolved and expanded and became a much broader discussion of how do we better facilitate federal collaboration around heat communication. So again, I said it expanded. We now have representatives from all these agencies listed here, and many of who are participating on this very meeting. So as I mentioned, we were working first on this heat-related illness graphic, and you'll see that evolution of changes starting there at the bottom, and it'll culminate in actually a co-branded graphic that I'll show in just a moment here. But in general, our heat season communication group has now expanded beyond graphics, and I'll be sharing a couple more things that we're working on, and also some of our future ideas. Next slide, please. So here's the final co-branded heat-related illness graphic. You can see it's been changed quite a bit from its original form. It's now been vetted by CDC and NIHHS, among other agencies that had a chance to contribute. And we have that co-branding at the bottom. We really highlighted the main symptoms and actions that you would find within heat exhaustion and heat stroke. And we're really calling out the fact that heat stroke is a serious condition that can lead to death. And so we have that call 911 there in bold on the right side. Next slide, please. So I said there was other things we were doing besides just graphics. One of those is a federal heat safety shared social media campaign. So NIHHIS and our federal partners will be embarking on the shared social media campaign coming up in May this year. And we're using a variety of platforms, Facebook, Twitter, Instagram, with the goal to really raise awareness and preparedness for this upcoming warm season. So this is May 16th through 20th, so you can look forward to that. And we have different themes for each day. So we're going to highlight a variety of issues surrounding heat and heat communication. The first day will be focused on heat-related illnesses. So you'll see that new co-branded graphic come out. The next day, heat vulnerabilities, then outdoor and indoor workers, then active populations, athletes, and other type communities. And then capping everything off with prevention, preparedness, and actions. So what do you do about it all? So not only will we be cross-sharing each other's materials across federal agencies, but we'll also be using a couple shared hashtags. So you'll see those here, hashtag National Heat Safety Week and hashtag NIHHIS. So be on the lookout for this shared campaign coming up in May. The WHO, well, we have a list here of the agencies. Many of them are the ones that have been participating in this working group, and who you also would see represented here during this meeting this week. So we have a full list of folks who will be participating with us and who you can check out their social media accounts. Next slide, please. So what are we going to do next? Well, we really want to build off the momentum that we've started. This group started small. It started with just a group of health experts to help inform an effort by the Weather Service, and has now built itself into a new set of relationships among communication experts within the different federal agencies. And we're really excited about our co-branded graphic and the shared social media campaign coming up, and we want to do more. So we're continuing to meet regularly, build on these relationships even further. We're looking to do more co-branded graphics in the future. And these will come out of our discussions and agency goals and needs. Things like targeting specific audiences like firefighters, athletes, farm workers, elderly, and others. Also highlighting the timeline of heat-related illnesses and really inserting where you can actually take action to prevent them earlier on, rather than getting to the point of heat stroke. And then also really creating more awareness around general actions and what to do during heat events, or even precautions to take leading up to the heat season. And then continuing and expanding on our shared messaging and social media efforts each year. So can we do more than what we did or what we're going to be doing this year in May? Can we perhaps do a mid-season reminder? So that's an opportunity coming up this summer to help people remember that, you know, we're a couple months into the heat season, but you can't let your guard down. You still need to be paying attention to what's going on around you. So we have multiple ideas, and we're really hopeful. We feel like this has been an incredibly successful collaboration, and we look forward to what's to come. Next slide, please. So I just want to say thank you guys, and I've loved hearing all the presentations so far this week, and I just want to put our emails up there if you guys are interested. We welcome questions and comments. I have here Kim McMahon, who you've been hearing from already this week, and myself. So feel free to email us if you guys have questions. Thanks, Morgan.
Thank you so much, Danielle. We are so excited about the upcoming heat season awareness campaign, and thank you and to Kim McMahon for all your work on that effort. Our next presenter in the Communicating Heat is Dr. John Balbus. Dr. Balbus is the Interim Director of the new Office of Climate Change and Health Equity within OASH. A physician and public health professional with over 25 years of experience working on health implications of climate change, Dr. Balbus has served as HHS principal to the U.S. Global Change Research Program and co-chair of the Working Group on Climate Change and Human Health for the U.S. Global Change Research Program since he joined the federal government in 2009. Before coming over to the new office, Dr. Balbus served as a senior advisor for public health to the director of the National Institute of Environmental Health Sciences. Off to you, Dr. Balbus.
Great. Thank you so much, Morgan, and congratulations to you and the whole organizers of this conference. It really has been fabulous so far, and will continue to be, I'm sure. For those of you not familiar with our new Office of Climate Change and Health Equity, we were one of the mandates given to the Department of Health and Human Services by the Biden administration under Executive Order 14008, with primary mission to protect the health of the American people from the impacts of climate change, especially those most vulnerable. We've also taken on the effort to make the health system of the United States both resilient to the impacts of climate change and also to work towards its decarbonization, since it's a big part of the emissions of the United States. So with that as background, I'm really excited to be here on behalf of our new office and to share with you a new product that this is kind of the first sneak preview for everybody. It is in draft form, but will be coming out next week. And it's our OCHE, as we pronounce our acronym, OCCHE Outlook, the OCHE Outlook for Heat. So next slide, please. You know, our office uses powers of collaboration and convening and consulting in the work that we're doing. And so the presentation I'm giving is really the work of many, many people from our office, from NOAA and CDC, primarily in putting together this product. Next slide, please. So this Climate and Health Outlook is kind of the culmination of the work of many of us over the past 5 or 6 years. The origins go all the way back to the previous administration and recommendations that came from the Climate Change and National Security Working Group. You can advance one. To put together some kind of seasonal forecast, if you would advance. There we go. To coordinate on predictive mapping products and forecasts to be able to anticipate and provide a kind of an early warning to the public health and healthcare sectors on climate change impacts. So that was part of the start. Next slide, please. This is also building on work that has been going on, very exciting work in the Caribbean area. This is the most recent version of the Caribbean Health Climatic Bulletin, which is a seasonal forecast product that PAHO and the Caribbean Public Health Agency and CIMH have been putting out now 5 years in the making, that provides some health interpretation. You know, the idea is to take the forecasts that come from our meteorological and climatological colleagues and to overlay that with an interpretation of what it means for people's health. Next slide, please. So this is work that we've been looking at within the Global Change Research Program and within our Climate Change and Human Health group, where many of us work, to create this what was used to be called the Climate and Health Monitor and Outlook. That was the name of the work stream that we were doing. And the idea is really to be able to answer these kinds of questions for decision makers, to be able to give this 30 to 90 day forecast of how bad is heat going to be, where are the risks greatest for climate related heat threats from the full array of climate change threats, which of course extend beyond heat. But heat is the topic of our first outlook and of course the topic of this meeting. Next slide, please. So this is an idea of the process by which we're creating this climate and health outlook. You can advance one. The scoping of this outlook and the initial framing and outlining of it is this collaboration that we've undertaken with the CDC, NOAA, and our GCRP colleagues, among others. But the idea is next that we would start with the hazard forecasts that come out, the 30-day seasonal forecasts, the NMME ensemble that NOAA puts out. And in the case of heat, we very specifically have used the Environmental Public Health Tracking Heat Health Tracker that Paul showed earlier, the amazing resource that is. Next slide, please. Or advance. We overlay that with health risk and modeling that health risk from agencies, including CDC, NIH, EPA, NOAA, and others. Next slide, please. What we're trying to do, though, is to provide an information resource that not only gives an idea of where and who, but then what people can do. And we have multiple audiences for this outlook, including the general public, but also emergency managers, the managers of health systems and emergency departments, as well as public health departments. And so we've tried to assemble as complete a set of prevention options and a lot of link outs as possible. Advance one more. And the idea is what I'm showing you is our first foray into this. We hope to be able to put this out on a periodic basis and to improve it as we go. And that improvement is really contingent on you in the audience. And I've just used the shorthand, the healthcare and public health sector. That's what the national security strategy talks about. But we really need to hear from healthcare professionals of all types, from the various levels of government, state, local, territorial, and tribal, in terms of the information that we're providing and whether it's useful. So next slide. With that, let me share with you, again, the sneak preview in draft form of our climate and health outlook. This is what it will look like. We have a greeting. And you can see at the top right there, we really want to focus in not just where, but who. If you advance to the next slide. And we do this on the left is the where. And this is actually an old version of our talk, but we will be showing exactly, this is the map that comes out on the Environmental Public Health Tracker and shows which of the counties are expected to have the greatest number of high heat days. And then on the right column there, you see the extension of the who. So looking at the demographics of those counties and identifying, the various populations and types of people who are at the greatest risk based on the epidemiology we've been talking about over the past day and a half. Next slide, please. And the current Environmental Public Health Tracker forecast is limited to 30 days, where it gives that county by county estimate of heat health days. We hope to be able to provide that over a longer time period in the future. But for now, we're adding into our outlook the map that comes from the the North American Multi-Model Ensemble, the NMME, which is not county by county, but it shows the regions where the greatest heat is expected to be. So you can see over the next 3 months, there is expected to be at least a 2 degrees centigrade anomaly over the center of the country. That's important information. We'll be actually trying to work with that HHS region to make sure that they are aware of this. Next slide, please. This is just one screenshot of how we are pulling together the different kinds of actionable resources so that different stakeholders, different vulnerable groups, or the people that care for them can have an easy access to resources that they need. So on the left, we have a link there to the amazing work that OSHA is doing. David Hayes told us about this yesterday, their national inspection program and the other resources that OSHA has for heat and for worker health. On the right is an infographic that's come from the low income household energy assistance program and the water assistance program. We'll be hearing more about that, I think, during the NIHHIS conference. But this is a federal resource that provides financial assistance to families to help them afford cooling. So that's our sneak preview. Next slide, please. And these are the different kinds of actionable information. You can see we're pulling from a variety of HHS agencies, including the human services agencies, which have not always been a part of the public health protection integrated in a one-stop shop kind of way. Next slide, please. So with that, I'll close, and this is our email address for feedback. Please keep an eye on this. If you are not already looking online and subscribe to our listserv, you can do it at the website you see there. If you just Google HHS OCCHE, that will take you to us. If you subscribe to the listserv, you will receive the Outlook when it comes out. And I would also just say I'm looking forward to be able to have the discussion perhaps at the end of the day today in the networking session with our state and public health, local public health partners. So with that, I will close. Thank you very much. And I thank you in advance for your feedback to us. Back to you, Morgan.
Thank you so much, Dr. Babas, and thank you for the preview of the Climate and Health Outlook. We are excited to see the final product in the coming weeks. So our next presenter is Bernadette Woods-Plackey. She is an Emmy award-winning meteorologist and director of Climate Central's Climate Matters, a program that offers data analyses, graphics, and other reporting resources to nearly 2,000 local TV meteorologists and journalists to help them tell their local climate stories. Bernadette develops partnerships with media organizations, nonprofits, and academic institutions in her leadership role with Climate Central, and serves as an expert on the links between climate change and weather. Before coming to Climate Central, Bernadette worked for decades as an on-air meteorologist in markets in Arkansas, Kentucky, and Maryland. She carries both American Meteorological Society certifications. She's a newly elected member of the AMS Council on the Penn State Meteorology Advisory Council and a former Penn State graduate of Earth and Mineral Sciences board member. She serves on the Weather Channel's Pattern Advisory Committee and is active in her local community, supporting the Watershed Institute as a trustee and Sea Change Conservations as a science advisor. Off to you, Bernadette.
Morgan, thank you so much for gathering this group. And I have to say, the tone has been so refreshing the past few days, such kind people sharing great information. It's just fantastic. So thank you. You've done a great job. All right, I'm going to move. I have a lot of slides and we have a little bit of time. So what I'm going to do, first of all, tell you a little bit more about Climate Central and then do a deep dive into our program, Climate Matters, which is essentially a case study of a communications base of changing heat and heat risk, not just heat itself. So first of all, Climate Central, for those who don't know, we're a nonprofit science and communication group. We're really focused on advancing this big, huge topic of climate change through science and through key partners. And it's great to be working with you. And we've worked with NIHHIS on some of the heat mapping project, which we will be doing again this year. So that's really exciting for us. All right, let's dive in. First slide here as we advance. We're going to look at Climate Matters. This is our program where we work with TV meteorologists and now journalists to connect them with information, content, data, resources to tell these stories, help them understand how it matters to their community and what can be done. And so TV meteorologists are really uniquely positioned for this program. They are, for the most part, scientists, and those who aren't are at least skilled science communicators. They have this ongoing conversation with their audience, and they're in the front lines of our changing weather and our changing climate. And so this is a program that was started 10 years ago We're celebrating our 10 years this year, so we're really excited about that. And we've been able to take this topic of heat, help get it out to the public, and help them understand not just the immediacy of heat issues, but how those are changing over time to keep their public prepared, because that's honestly really the goal of most meteorologists in general, TV or not TV, is to help people be prepared for what's coming. And when we look at our changing climate, we know these scales are so severe and so big. So next slide, please. This is a proven model that has worked. We've worked with our great partners on this program, Ed Maybeck at George Mason University, NASA, NOAA, the American Meteorological Society, Climate Communication, a whole big group of people. And we've done a lot of research around this and a couple of papers that have been published to show that this work does advance this subject matter for the public in a scientific way. It's also been used as a case study for communities of practice and trusted messengers and how we can move climate change forward. And if you go to the next slide, this has also been brought into the media in some really unique ways too. As many of us know, the media has been slow to pick up on the subject of climate change in some really big scale, pertinent ways. But we're seeing that change happen. And we're seeing a lot of it advance through weather. Even at the big networks on television, their climate units are really coming in through their weather teams. So this is a great example of how you can take this, connect it with things that people are feeling right now, and help them understand what's coming. Next slide, please. Okay, a snapshot of our network. So for perspective, there are about 2,200 meteorologists in the United States. And this is supposed to be a video. I guess it didn't start automatically, but you can move on, it's okay. It just shows our network really has grown across the entire country, working in, we look at these media markets, and there's 210 really scattered about in population bases around the US. We're working in pretty much all of them. So this isn't just a divide of politics, as we often hear around climate change, but when you're working with the meteorologists who are these scientists, and they're feeling this, they're bringing this information everywhere to their public. And I'm going to show you this snapshot of an example of what we share with them, both so that you can understand sort of the resources we've supplied, because I know a lot of you have great resources that we can also supply to this network, but also you are most welcome to use any of these resources. We'll get you the links and you can sign up. We send this information out weekly. So here was an example of a report that we did on heat in senior citizens. This is COVID was really kicking in and we wanted to take like a deeper dive into a specific population. So just move through these slides pretty quickly. I'm going to highlight a few of the different areas here. When we package this together, we create a data analysis into visuals that they can use in their local communities. You know, we've got this big subject, it's a global topic, but you feel it locally, experience it locally. That's where we see these actions. So if you could just move along here with the slides, there's a snapshot of the visuals we'd like to give the national perspective, but again, the local one. And then on to the next slide, we package this really a snapshot of what are the top line findings that we found when we put this together. Because as you know, well, most people, not just media, they're moving pretty quickly. Like, is this worth my time or not? So we try to highlight that there. Then next slide, we package that with a deeper dive into the science, resources, methodology, other reporting resources, how to localize this, what are some of the solutions that exist, who are some experts that you could interview on the subject matter. Next slide, please. And then we also always show them from our archive. Since this program has been around 10 years, we have a lot of stuff in that archive. Other ways to build out this story that could be relevant. Next slide, please. And I'm going to give you a snapshot of some of the topics, because again, I said we do this weekly for 10 years. There's a lot of stuff. We've cut temperature almost every way. And we try to connect with health as much as possible. So simple explainers, like what's a small shift in temperature, right? What is a degree? Why does that matter? Well, it puts you in a whole new climate zone. Then taking different cut analyses here. For example, Miami, a streak of 90+ days. For Phoenix, we look at that as 110. For San Francisco, it might be 80, 85. So we try to make that relevant to the local communities. Also, how's that trending over time? And when we look at the ratio of records, you know, we're really pushing things out of whack here. Let's look at the next slide, please. How does this apply to health? How does this apply to our lives and our livelihoods? And this is just a snapshot of some of the heat-related content that we've accumulated over time. Next slide, please. Heat islands. We did a big report on this last year. There's so much interesting information we've already been hearing about, and we will continue to hear about on how these urban populations are unevenly hit with this extra heat. And this is a way that we did it. And we really took sort of this index we were able to apply to a lot of our communities. And then if you look at the next slide, it's a really interesting case study of how this worked, right? So Shel Winkley, he works in Bryant, Texas, and he loved that analysis. He brought it to his newsroom. He had a reporter do a story, not just him, because he wanted to give it a little more attention. Well, he came back from vacation the next week and he found that their local community, their local government didn't have a climate action plan in place. Well, he knew that, but he found that they had contacted him and the reporter for this information because they used it to prompt the local government and how they were going to come up with a local climate action plan. So when we create this content, we really try to make it local, accessible, relevant, and timely. And again, any of you are most welcome to use it. Plus, I welcome any ideas and collaborations on stuff you're working with to get it to this community. Next slide, please. We approach our network really in three big buckets. One is education. We do workshops, webinars, we go to key conferences outside of COVID. We're doing a roundtable with NOAA on the next round of heat mapping that has just, I think it was just yesterday, all of the cities were announced for this year's project. And we've done that the past couple of years, again, to really connect these communities and help people understand what's going on. The second thing is the content, and I showed that to you. If you go to the next slide, this is where you can find all of that bookmarked. And I will be very upfront that our website is about to be updated. It's a little clunky in the search mechanism right now, and we know that, but we're talking in a matter of weeks, we're going to have a new site, which is going to make it even better and easier to find this information. But you're most welcome to sign up and use anything from here. Next slide, please. We also have created this alert system that takes all our content and it built it into this really cool tech build that essentially goes out and reads the country on different data sets for these climate related events, then pairs it with content and sends it out to people. So while we send out this weekly package of content through our program, we also know that not every day is there going to be, say, 3 inches of rain in Tulsa. So when it does rain like that, it'll pair it with content and send it out to people. So again, you can go and sign up for the alert system for your local community if you're interested in that at this link here. And if you go to the next slide, please. We also work with local media to produce stories, and we do this in a deep dive with partnership journalism. So you can find a range of different stories on our website here. Some really cool ones where we're able to go that much further into the story locally when it comes to heat and health. And there's a lot that we've done on that. So here's just a snapshot of a few that we've done, but there's a lot more in there. Next slide, please. So what have we learned? Because I think it's really important to think of how we've been able to help people communicate. And I think all of us can learn from that. So our top lessons learned, the working with this community, know your audience. Again, everyone knows that's the golden rule of communication, but there's so much in there to unpack. Consider topic, timing, tone, really think about who you're talking to and in which way to help them understand what's going on. Meet people where they are. We know that people come in at a wide range of angles and have had a lot going on lately, and they may be a little frantic about things, but we have so much more that connects us than divides us. So meet people where they are, and that's a great way to engage in this conversation. Simplify, drop the jargon. It's great that in these communities, we can be so scientific, but not everybody follows science the same way. And so you don't want to lose them along the way. It takes a real skill to be able to break that down simply. Personalize, localize. We do this often through localizing our data or working with people in local communities that can draw out the faces of that community and the voices of them. There's always a way to engage by localizing and personalizing what's going on. Tell a story and don't be afraid. I was in a recent other workshop and I know people have heard this phrase, but it just landed so well. It's don't let perfection get in the way of progress. I mean, we have a lot of work to do. It doesn't have to be perfect all the time. Let's move forward. Let's not be afraid. We have a lot of people that we're going to help here. So next slide, please. We've got a new project that's coming out. I know time's limited, so I'm just going to put this out here. It's launching in June, and we're really excited about it. Happy to talk to anyone who wants to follow up later about this. But as attribution science has advanced in the world of climate change, we're doing a dive on daily temperatures and the role climate change played in those daily temperatures. It's going to allow us the ability to get climate change messages into more communities more frequently. And it doesn't just isolate to those extreme events, such as a Pacific Northwest heat wave, where there are going to be attribution studies on this. This allows us to get to those 70-degree days in March across the Northeast that are not normal and do have a climate change fingerprint to them. So it's a new project we're working on, another way to connect with our community and help get these messages out. And again, I welcome your questions. I welcome them here, but also in follow-up. I'm going to put my email in the chat. So thank you, Morgan. I think that is my time.
Thank you so much, Bernadette. That was such a fantastic presentation. And I mean, Climate Central Climate Matters is such an amazing program. So thank you for being here and presenting your work. Our last presenter for the communication session is Hunter Jones. Hunter is the Climate and Health Program Manager in NOAA's Climate Program Office. He leads CPO's Extreme Heat Risk Initiative, managing a grant program for applied urban climate research to reduce climate and health risks. He also leads the National Integrated Heat Health Information System's Urban Heat Island Community Science Field campaigns, empowering communities to map, model, and understand how heat is distributed throughout their communities and informing action to develop equitable climate resilience. Hunter is the Vice Chair of the American Meteorological Society's Board on Environment and Health, as well as a member of the Global Heat Health Information Network. Hunter develops new climate services for health capacity at NOAA and internationally, such as modeling climate-sensitive infectious diseases. Off to you, Hunter.
Thank you, Morgan. And thank you, Bernadette, for the nice setup. Hi, everyone. I'm excited to share with you how the National Integrated Heat Health Information System communicates heat risk using citizen science through our urban heat island mapping campaigns. Next slide, please. In case you needed a reminder, extreme heat is often referred to as the silent killer. And there are many implications to this, but one of them is that a lot of people don't take heat risk seriously. This is a challenge when it comes to getting individuals to take actions to manage their own risk, but also when it comes to community leaders having the support they need to take actions to mitigate risk at the community scale. But as this quote from Beckman and Haidt in the lower left reminds us, people who know more about heat waves are more likely to perceive heat as a risk. And if we can assume that finding transfers to people who know more about urban heat islands and the inequitable distribution of temperatures across neighborhoods, then communicating and educating around urban heat islands is essential to building heat risk perception. On the right, you can see a map of San Diego from the Yale program on climate change communication, showing that a lot of the county has a relatively low heat health risk perception. And we think that one of the solutions to this is represented by the map on the far right, which is a product of the citizen science urban heat island engagement. Next slide, please. So let us explore one of these urban heat island maps. This is one from the campaign in Charleston, South Carolina. As you can see on the left, a nice smooth surface with high resolution air temperature information from a hot afternoon last summer. And we also have heat index available. This map was produced by Kappa Strategies, our private sector partners. They integrate citizen science observations and satellite imagery using a machine learning process to create these surfaces and to give cities a data set they often don't have. Often they might only have land surface temperatures to work with. On the right, you can see clearly a transect that was driven or biked by a volunteer citizen scientist collecting temperature, humidity, and GPS location every second. The communication value of the surface and the transect is high because they're developed from on-the-ground observations. And the citizen science collection of the data really creates an important educational and media moment to get the word out about extreme heat in our cities. And I should note that all the data and maps from the campaigns are open and available on the NIHHIS site. Next slide, please. For example, the moment these campaigns are announced, and this has just happened, local, state, and national media are eager to cover them. And thanks in part to a media roundtable that we organized with Climate Central, thanks to Bernadette, we really get a lot of attention to these campaigns. On the left is the NOAA announcement that went live yesterday regarding the upcoming campaigns. And I've already heard from about several news articles and from several journalists that are interested in covering this. On the right, you can see press coverage from last year, which we try to track on the NIHHIS site. Just to give you a sampling of the communities that these campaigns reach, they include the faith community, local NPR affiliates, national news outlets like the Washington Post, and academic news outlets like Science Magazine. Next slide, please. During the campaign, education and communication are also happening. These projects are hands-on and community-driven, affording a learning by doing approach. In more recent campaigns, CAPA Strategies began to make infrared cameras available to participants, and you can clearly see how effective it is to provide an instantaneous read on the differences in temperature between, say, a shady tree in the lower left corner and an exposed and dark basketball court in the upper right corner. I was happy to see some discussion in this meeting yesterday regarding materials used in playgrounds and sports equipment. So here's some direct evidence of the importance of considering how materials affect surface temperature. Next slide, please. Beyond the direct data collection portion of the campaigns, there are so many other opportunities to educate community members and raise awareness of the health risks of heat. These campaigns are always locally led, often by a collection of different organizations, including environmental justice NGOs, universities, chief heat and resilience officers, and also quite frequently science museums. And you can see here just a couple of examples from Wicked Hot Boston in Massachusetts and from Throwing Shade in RVA in Virginia, how museums leverage these campaigns as opportunities to create programming and exhibitions around extreme heat. Next slide, please. I mentioned chief heat officers and resilience officers, and so I wanted to also show you that these campaigns create an important spatial data set for communicating the bigger picture of heat risk. Once we've mapped the hazard and we have a handle on exposure, many communities develop social vulnerability indices and heat risk maps to identify where people are most impacted by extreme heat and to consider actions that could be taken to reduce those impacts. In this example from Oahu, Hawaii, it's a fantastic one because they use an Esri story map to tell the story about how the heat hazard and vulnerability come together to create risk. Many of the communities we work with do develop such story maps to communicate the components of heat risk. Next slide, please. And finally, another form of communication stemming from these campaigns is in an educational setting. This example is from Worcester, Massachusetts, where several undergraduate students at the Worcester Polytechnic Institute built their senior project from the campaign that happened there. The communication and engagement they wanted to have with the public was a bit constrained due to the pandemic, but they did find opportunities for digital engagement and applied campaign data to consider where there were strong opportunities to plant trees to make up for losses due to the invasive Asian longhorned beetle, while also mitigating urban heat. Next slide, final slide. To close, I thought it was appropriate to have this picture up of volunteers from Abingdon, Virginia, who made their own NOAA shirts for the campaign. I want to reinforce and paraphrase what Mark Couder said yesterday. He's from Austin, and he said, stories need data and data needs stories. And these mapping campaigns have created an amazing opportunity to communicate heat risk, build community, and tell individual stories about how some neighborhoods can be much hotter than others and what it's like to struggle to cope with heat when you work outdoors or you have to commute in ways that expose you to heat for extended periods of time. So I can't wait to see what we learn from the campaigns this summer, and I'm looking forward to them, and really appreciated having the time to talk to all of you. So thank you.
Thank you so much, Hunter. And again, thank you to all of our speakers in this session. I know we only have 1 minute left, unfortunately, until we turn it over to our closing keynote. So one question I did see to come in the chat that either Bernadette or Danielle, if you're both still on, could be able to answer, but a question that came in, is there any interaction between the National Weather Service warning systems and the Climate Central alert system?
There is not, but Danielle, let's talk. We are trying to build in right now. For heat, what we do is essentially read temperatures that spike at a certain level, and one of our primary goals is helping people understand how that's changing versus the immediacy of taking action right then. But one of the other data sets we're trying to build in is the watch warning system from National Weather Service. So I think there's a lot more we can do with that. But Danielle, I welcome a conversation.
Certainly. Thanks, Bernadette.
And we have reached the end of our hour. Again, thank you all so much for your insight on climate and health communications and for all of the work that you all do in relaying this important information to audiences. And thank you to the audience for not only the questions for this session, but also throughout the entire day. You've been a really engaging audience today. And now I will turn it over to Julie Turton to introduce our closing keynote speaker.
All right. There we go. That should work. So what an amazing day, actually. Thank you all. I just want to say, yeah, I learned so much, and actually the connections in the chat have been great. So thank you, every single one of you, for showing up and staying here. I have the opportunity and the honor of transitioning a little bit to how do we actually do this, both to support the protection of U.S. citizens at home and abroad, and also to contribute and learn from our international community. And so when we first started NIHHIS, we were actually already, the meeting in Chicago you've heard referred to a few times included, much thanks to Joy and folks at the World Meteorological Organization, partners in India and the Near East and the Far East. And we had a few other partners who were already beginning to tackle this issue. And we subsequently realized that while we were trying to fix and figure out this problem across timescales in the US, other countries were doing the same thing and approaching the forecasting in different ways, the communication in different ways, and that we should really be learning from each other. So we were really interested, as we launched NIHHIS, to have an international conversation and a place to do that, and where other countries who are also beginning to learn about this and develop different systems and what's working and what's not. And also from a global perspective, what are the standards for Met services and health organizations and the like? So it became pretty evident that we needed not just a US focused piece, but also a place to communicate globally about this and to work together across countries so we could actually move further faster and protect people faster than we were able to do right now. So we were really pleased to have the World Meteorological Organization, the World Health Organization, launch through their joint office, which Dr. Shumat leads, the Global Heat Health Information Network. Now, it didn't start out under that office. There was a bit of a process to get there, but from a US perspective, we were really happy to have the Global Heat Health Information Network be a place where we can participate in a global conversation. From the US side, we've been very active in helping support and help get that stood up because we feel it's very valuable. We learn a lot from it, and we feel like we can contribute some to it. So it's my distinct honor to thank Dr. Shumat for joining us. I know it's been not necessarily easy to get at the international scale the time to do this, and it's very late for you. So we're really grateful to you for joining. She comes to us from the World Meteorological Organization and the World Health Organization Joint Office for Climate and Health. I have the opportunity to work with her on the Global Heat Health Information Network and some other activities about delivering climate services for health. And Joy, I think without further ado, I know you've got a lot of credentials and a long bio, but you come to this from a background on both the health and climate side and disaster response. And so I think it's unique that you are able to be in this position to help lead the global community. And we're really grateful that you're here to talk to us about the international perspective. We had Assistant Secretary Medina talk to us from a US perspective, and now we're just really honored to have you here speaking from the other side of the equation. So Joy, over to you. Thank you for being here.
Excellent. Well, thank you so much, Julie, for that introduction. And I'd like to start with a big thanks, not only for the invitation to join this conversation, but also to NIHHIS for welcoming international participants to this national meeting, because there are actually many attendees that are joining today from outside the United States. And so we really appreciate the opportunity that you're providing to others to learn from the approaches that are being pioneered in the US. And I also want to say on behalf of the World Meteorological Organization that we want to congratulate the administration for taking extreme heat so seriously and really striving to be a leader in both the science and policy on this issue. And we particularly want to applaud NOAA, the CDC, and all the agencies involved in NIHHIS in making it a reality. I have been super impressed by all the work that has been presented this week. And I can say NIHHIS really is truly a global champion program that we hope will inspire others to develop similar integrated heat risk management programs. So next slide, please. So to put us in an international mindset, I'd like to take us to the Indian subcontinent, because right now, as we are having this webinar, there are hundreds of millions of people having a sleepless night due to the searing heat that is spreading across the subcontinent right now. So in India, March and April have experienced a record number of heat waves. New Delhi alone, having 30 million inhabitants, has already had 10 heat wave days in the month of April. And the maximum temperatures in parts of the city are over 110 degrees Fahrenheit, reaching 113 degrees. And we know that in urban microclimates and in informal settlements, this might be even higher. And this heat is now spreading from the Middle East all the way across the subcontinent, affecting a lot of different countries this week. And so the headlines in the regional media are full of stories about the impacts that they're experiencing. And we're hearing that hundreds of thousands, if maybe not millions of children right now, are unable to learn because schools are closed, because the administrators recognize they can't offer children safe conditions and that these excessive temperatures will affect their ability to learn. But unfortunately, it's not as if these children will be able to stay home in air-conditioned safety or have cooling centers readily available that they can go to. Because 9 out of 10 households in India do not have access to air conditioning. And where it may exist, the blackouts may be rendering it entirely useless. There are very few cooling options to the majority of populations in these regions. And at the same time, the livelihoods that the families depend on are also being jeopardized. We know in informal economies that day laborers, such as agricultural workers, street vendors, construction workers, are unable to work more than a few hours when temperatures reach certain levels, or may not be able to work at all. And crops, particularly wheat in the region right now, there's a big concern that they are failing and will have major impacts on the formal economy. So you recognize this story from the earlier session today. The domino effects of heat are extensive, and they're actually probably far beyond what we're actually recognizing. Next slide, please. And these scenarios are playing out worldwide, from Phoenix and Seattle to Zimbabwe and Bangkok and London. We're hearing these repetitive stories, and it is very clear that extreme heat is an all of society problem. And this problem is global, and it's growing due to climate change. We know that these rising temperatures are impacting people and economies, exacerbating social inequalities, causing preventable illness and death. The impacts on the environment are vast. They're contributing to more intense wildfires, worse air quality, and water scarcity. And the high temperatures are impacting critical infrastructure and technology that we all depend on. And so the point is that this all of society problem summons us to also take an all of society response and start to also think globally about what we may consider to be very localized impacts. Next slide, please. So I hope you have all seen the latest IPCC report, the AR6 that was issued in February, because it has some very strong messages for extreme heat. So here we are looking at a schematic map of the world, and those blocks in pink have seen increases in extreme heat. And the 3 dots that you may and may not be able to see, but many of them have 3 dots representing high confidence that the increases in this heat are due to our own emissions. Next slide. So looking forward, the science tells us with high confidence that extreme heat and our exposure to it is only going to increase. That the combination of increasing temperatures, urbanization, and aging populations is deadly. And it will lead to increasing heat-related illness and mortality. And these impacts are going to be particularly inequitable across the world. So the message here is that we are literally walking into the fire that we are also stoking. So if we are not able to slow the rate of global warming, we will be unable to prevent our exposure to these increasing frequency and intensity of heat waves, hot nights, and longer heat seasons. The IPCC does also tell us that we are not too late to stop the worst of the consequences, but we need to hurry. Next slide, please. So if we are to safely live on a warmer planet, we have to get really serious about shifting the energy economy and mitigating climate change. To keep global warming to no more than 1.5 degrees increase above pre-industrial levels, as called for in the Paris Agreement, emissions have to be reduced by 45% by 2030 and reach net zero by 2050. Net zero needs to become a household concept. We all have to be committed to emission reductions, be it at home, in the workplace, or at the federal level, because every decision and every action matters from here on. And we can particularly no longer separate our efforts to mitigate climate change and adapt to its impacts. And this is particularly true for extreme heat. The solution cannot look like this picture, with fossil fuel intensive air conditioning units for every home. We have to rapidly scale up sustainable cooling options, revolutionize the cooling technologies that we have, address energy poverty, and maximize nature-based solutions for environmental and passive cooling. Next slide. And when it comes to adaptation, well, frankly, it's just no longer optional. And I'm not sure that has become a household concept either. It may be obvious to this community, but it's not just about preparing for heat waves and extreme heat days. It's really about shifting how we live to be more resilient to warmer conditions with these cascading extremes. So internationally, we do see an increasing political and financial investment for adaptation, but it's certainly not happening fast enough to protect the most vulnerable, like those across the subcontinent. Next slide. So to confront these challenges, the Global Heat Health Information Network was launched slightly after NIHHIS in 2016, as Julie started to mention, because we recognized this tremendous gap in global awareness, capacity, tools, and policies to support this societal adaptation to extreme heat. And I would say that the two initiatives of NIHHIS and GIN have really grown up together, learning from each other over the last few years. And in fact, GIN would not be possible without the partnership and support of NOAA. And today, GIN is a UN initiative that is bringing together governments and partners to be able to learn from each other, to rapidly accelerate what we know about extreme heat risk, and most importantly, start scaling community action and policies that we know work. Next slide. So in 2018, we issued a call to action, which drives the common mission of the network and its partners. And to accelerate heat adaptation, we feel these 5 things are really critical, that we have to urgently raise awareness of the risks of heat, which we've just talked about. We need to improve access to the expertise, including the participants here today in this conversation, to be able to build global capacity. We need to be synthesizing and harmonizing what we do know into scalable good practices. And through partnerships, broad partnerships across countries and sectors and actors, we need to scale up interventions and actions that we know can save lives. Next slide, please. So to do this, GIN has learned immensely from NIHHIS in its integrated approach, that you need to have empowered and engaged people with the right information to take effective action. So we have this 5-pillar action framework, which builds on these principles. And we encourage our partners to consider in all of their activities, do you have the right people involved? Do you have the right information to make sound decisions? And are you evaluating whether the actions you are taking are really making a difference? Next slide. So what is GIN actually doing? Well, we're involved in a broad range of activities right now, all of which I can't go through, but we're currently focused on a few key areas where we think a lot of attention is needed to better understand the issues and start cultivating solutions. And I think for obvious reasons, these are all familiar to you. And these are including urban heat issues, occupational health, maternal and child health, cascading risks, as well as indoor heat. So I want to quickly share 4 of our cross-cutting activities that you see listed at the bottom, where we hope we can collaborate more with the NIHHIS community. Next slide. The first is on early warning systems and scaling up. So early warning systems, as we've heard, are a vital part of climate change adaptation and addressing extreme heat. And here in the US, you have the amazing benefit of the National Weather Service, who's providing state-of-the-art heat advisories. But globally, there is an unacceptable inequity in the coverage of early warning systems. 1/3 of the world's people living mainly in least developed countries and small island developing states are still not covered by early warning systems. In Africa, this is even worse, where only 60% of people are lacking coverage to early warning systems, including heat. And so a few weeks ago at the World Meteorological Day, UN Secretary General Gutierrez announced a new initiative to ensure that every person on Earth is protected by early warning within 5 years. And so as a WMO initiative, the GEN will be supporting this in the rollout of heat health warning systems in underserved areas of the world. And we're starting by improving our existing guidance for heat health warning systems, impact-based forecasts and advisories, and risk communications that can reach the most vulnerable. Next slide. We are also focusing on indoor heat through a new partnership with the World Health Organization and Health Canada, and we'll be issuing some reports, hosting a series of consultations that we invite you to get involved with. And ultimately, we'll be developing a toolkit for policy and decision makers to help them inform a range of complex challenges that they may face as housing authorities or building managers or even homeowners. This is a new project, but we certainly will want to draw upon the experience and the science from the United States, where we know a lot of work has already been done on indoor heat risks. Next slide. And we recognize that many of the most important actions happen at the community and household level. And so we are partnering with the Red Cross, Red Crescent family this year to learn from community-based research projects in 12 countries. And through these projects, we're hoping that we can build capacity of local academics and students in low and middle income countries through learning exchanges and mentoring. And we will also be able to discover some of the things that are really important to addressing heat risk perceptions, indigenous solutions in different parts of the world. And finally, in the next slide, please. We want to call attention to our efforts to build institutional capacity around the world by partnering with other heat-focused initiatives, such as NIHHIS, as well as the South Asian Heat Health Information Network, and also leveraging other knowledge brokers, such as the Anticipation Hub, REAP, as well as ERA, C40, and many others that we're also working with. Because through this regional approach, we can start to amplify the tools and resources that are available and amplify capacity. So on our website, we already have a great repository of resources. So please have a look at the case studies, the projects, the tools, data sets, resources that are available in multiple languages from around the world. So next slide. In closing, we are all on this hot planet together, and we have a lot to learn from each other, particularly the experts like ourselves who are addressing these issues. So I invite you to get involved and share what you're doing with the international community, because you may not think that your project in Iowa or Seattle is necessarily revolutionary, but it might just be the kind of solution that friends in Kenya or Malaysia are looking for inspiration and a model that they may be able to adapt to their situation. So I really encourage you to get involved with us. Keep a lookout for some of the new products, reports, and events that we'll be launching in the next couple of months. We'll be hosting several consultations. And of course, we will be in Egypt for the COP27 at the end of the year. So I'll end here. On the next slide, I'd like to give a big thanks to NIHHIS from our management committee for the collaboration. And if you want to learn more, please join us tomorrow morning for the International Coffee Hour. Thank you so much.
Joy, my unmute is quicker than my video. So thank you so much. Really, what a great way to end the day. And actually, we heard so much specificity and really like heartwarming and tear-jerking stories about why we should continue this. And then to hear from you at the end of the day about recognizing, actually, I appreciate hearing the value of, from your perspective, of engaging the United States. And I think we heard yesterday about why some of our leaders think it's important. So I feel, you know, extra inspired maybe to build this out, and just want to encourage folks to join us for the international discussion tomorrow. It's 30 minutes, and so it's really just to kind of get the lay of the land and kind of get a game plan or just understand what's going on. But thank you so much for making the time to be here. I know it wasn't easy, and those of you who are on you know, the international UN I guess mandate scale are in high demand. So thank you for being here and for being so supportive of us. And for us in NIHHIS and the US, it's been fabulous to be a part of this. And we're looking forward to really kind of the next steps. You've laid out a few on-ramps, as I'll put them. And I know there are some more that have been discussed. So we'll get to those tomorrow. I think we're just a few minutes over. So I think I will say thank you to Joy and turn to my closing of the day duties, if you don't mind. I hate to do that because it's been such an amazing day. I don't know, my brain is full with all the amazing work that we've seen about, from, you know, the top to bottom of the day, down to, you know, like what are we actually doing in communities? What are the vulnerable populations, the cascading impacts, and the like. So let me just pause and say thank you to all of the speakers and the moderators. We had a really full day. We've actually had a consistent engagement. So I think, you know, I was expecting to have a fewer people today, but honestly, you guys showed up in spades, and I am so excited to be a part of this community and help leading it. So it's really, really cool. What we're going to do now is go to that networking session. So let me just start with saying two things. One is that this NIHHIS National, as originally envisioned, was going to be like jointly developed with many of you that are kind of here, but it ended up being a great opportunity to re-engage the federal side of things with this administration, which you heard yesterday, and also engage many of you now. So the networking session is going to be, this is our time to actually kind of figure out what's going on and listen to you all. So we are moving into a networking session hosted by the Association for State and Territorial Health ASTA organizations and the National Association of City and County Health Officials and the Group on Earth Observations Health Working Group. And so we also are asking for anybody who is interested in looking at the Climate Health Monitor or the Climate Health Outlook that Dr. Balbus presented earlier. Like, we will be happy to have feedback on that either now in the session or future. So that's an opportunity here. So we're going to do the switch to the Wonder in just a minute. And I will just say that if you got kind of booted out and had that black screen, everybody did. We really don't know what's going on, but once you get through that, you just hit refresh and come back in, and it seemed to be fine. So otherwise, that platform works well, except for getting booted out. So if that happens to you again, don't take it personally, just hit the refresh and come back in. It seemed to be really cool. And actually people we noticed were staying on even after the sessions were officially over. So I think without further ado, I will just one last quick ask of Morgan, if there's anything else that she needs to say, because we're all monitoring stuff and if questions are coming in, but I think that the action is to go into your chat. We put the Wonder link in the chat. It's also in your email. And then you'll be able to pick ASTO, NACHO, or GeoHealth Community Practice. But you can also go from one to the other, and you can create your own little circles here. So Morgan, is there anything else you wanted to add? And by the way, great job moderating the entire day. So yeah, anything else from you?
No, that's it. Again, thank you all so much for being here. Hope you can join us in the networking session. And again, like Julie said, if for some reason there is some booting of us all out, just keep refreshing. It'll eventually work. But thank you again for all being here.
Yeah, and please show up tomorrow morning. This morning's coffee hour with the indicators group was great. It actually, we had so many people. It was fantastic. And what we decided to do, like right off the bat, is there was more conversation than we could possibly have had in 30 minutes. So we really want to hear from those of you who are interested in the international engagement in one way, shape, or form tomorrow morning, and then we'll figure out the follow-on actions from there that NIHHIS and Jen can do. But Joy, thank you for hosting that coffee hour, and we hope to see you all at the networking session in just a few minutes and at the coffee hour in the morning. So, all right. Thank you so much for everybody, the moderators and the speakers, the participants. Obviously, we're all important in moving this forward. So I think just if you go into the chat over on the right-hand side, you should find the link, and we'll see you over in the Wonder platform for the networking session. And I will officially close out the day. Thank you all so much for being here. And Morgan, thank you for running the show. And thank you to everybody who moderated and spoke and participated in these super active chats today. Really fabulous day. See you tomorrow.